Okay. I'd like to call to order the Monday, June 29th special board meeting. Roll call, please.
Reagan.
Yeah, I don't think you heard me.
Reagan.
Sorry about that. Here.
Forsythe. Lightfoot.
Here.
Sheridan.
Here.
Denisha.
Here.
Perkins.
Here.
Akers.
Here.
Fay.
Here.
Haggard.
Here.
Burke.
Here.
Arquette.
Here.
Terminelli.
Here.
Curran.
What's that? Okay. I'd entertain a motion for approval of tonight's agenda for the special board meeting by Mr. Arquette, seconded by Mr. Perkins and Mrs. Haggard. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Move to the presentation of the resolution. Mr. Fay.
I would like to move the following resolution, appointing Suzanne Fiacco to the vacant seat of the St. Lawrence County Board of Legislators, District 11, by Mr. Perkins, District 7, by Mr. Fay, District 9, by Ms. Haggard, District 10, by Mr. Arquette, District 13, and by Ms. Terminelli, District 14. Whereas former legislator Nancy Arquette has submitted her resignation to the board effective May 31st, 2020. By virtue thereof, the seat from District 11 has been vacant. And whereas the ad hoc committee, the remaining Democratic legislators, has been appointed by the chair of the Board of Legislators, and whereas the ad hoc committee has submitted its recommendation to fill the vacancy created to this board, and whereas by the wording of local law 7 for the year 1978, this board is bound to follow that recommendation. Now, therefore, be it resolved that upon recommendation of the ad hoc committee, Suzanne Fiacco is hereby appointed effective June 29, 2020 to fill the vacancy created by the recommendation, and pursuant of section 42 of the New York State Public Officers Law, that this appointment will expire on December 31st, 2020.
Is there a second? Second by Mr. Perkins. Mr. Arquette, Ms. Haggard. Anyone else? Did I miss anyone? Ms. Terminelli, I'm sorry. All in favor?
Aye.
Aye.
Any opposed? Resolution is carried. We will now have the swearing in ceremony by the county clerk.
Raise your right hand and repeat after me. I state your name.
I, Suzanne Fiacco,
Do solemnly swear
do solemnly swear
that I will support the Constitution of the United States,
that I will support the Constitution of the United States,
the Constitution of the State of New York,
the Constitution of the State of New York,
and that I will faithfully discharge the duties,
and I will faithfully discharge the duties
the office of St. Lawrence County Legislator,
of the office of St. Lawrence County Legislator
according to the best of my ability.
according to the best of my ability.
Congratulations.
Now, Suzanne, if you want to go into the office there
Yep.
and sign the book.
And being that there's no further business, we will adjourn until the start of the Finance Committee meeting.
Joe, do you know if Dave Forsyth is attending tonight, or is he wanting to be excused? Do you know? Have you heard?
I think he is on now, Kevin. He is.
Okay, I see him there.
Okay.
Grizzly Adams there. Okay. Okay, Kelly, Ms. Pearson, are you ready?
I'm ready, yep.
Okay. So I'd like to call this the finance meeting to order and would consider a motion for approval of tonight's agenda.
So moved.
By Mr. Perkins, second by Ms. Terminelli, Mr. Fay, and Mr. Denisha. Resolution for approval of the minutes from May 18th. Anyone? Mr. Perkins again, seconded by Mr. Denisha and Mrs. Haggard. All those in favor signify by saying aye.
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 Opposed, motion carried. I guess we were supposed to do that on the first one too, weren't we, Kelly? I guess unanimous, all right. So next up is our COVID-19 update. We have Dr. Williams and Dana is also. Who would like to go first? The first one to unmute gets to go. Dr. Williams, you're on, you win.
All right. So the way we're going to do this tonight, actually, I was going to go over some of the background information, but Dana was going to give an update afterwards, talking about the current status of the cases. So one of the things I wanted to talk about was where we stand with testing in the county. And I'm pleased to say that we've done more than 17,000 tests at this point, nearly 18,000 tests, which is a significant increase just over the past month since I last made a presentation. And just to review the kinds of testing that we're doing, we're still primarily doing what's called PCR testing, which is looking for acute infection, both for asymptomatic, but also for symptomatic patients. The serologic testing that people have heard a lot about is still being done. It's being offered at both the hospitals and in some doctors' offices, but again, we find that the serologic testing is not as useful. It's mostly just helping us tell from an epidemiologic perspective how many people might have had the illness in the past. One significant advancement is that both hospitals are now able to do point of care testing. So if somebody were to present to a local hospital ill with symptoms, we are now able to get an answer as to whether they have COVID or not within an hour. So we're utilizing those tests at both hospitals, which has been helpful. In terms of who we're testing, we're still testing, symptomatic people or people who have high risk exposures, but we've extended to do more targeted screening of high risk groups. So as people know, the nursing home employees were undergoing testing twice per week. Hairstylists and healthcare workers are just among the other groups who are getting targeted screening. But the testing is generally more available. So we have people who are opting to be tested because they're going to be visiting an elderly relative or they have insurance. As far as where the testing is happening, it's still primarily at the 6 testing centers that are run by the 2 hospitals. The nursing homes had been doing testing of their employees independently. New York State has offered to set up separate state-run testing sites in the North Country, and Ruth may be able to talk to that later. Right now, they're providing some supplies to the hospitals that are running the testing centers. But again, there's some talk about the state having separate testing sites. A number of issues have been brought up concerning testing, and I thought I would just mention them briefly. So one of the questions is occasionally people have what's considered a false negative test. So that's when somebody actually does have the illness, but the test comes back negative. It's still relatively uncommon, but it is more likely when you're testing people who are either asymptomatic or pre-symptomatic. And we think that has to do with a limitation of the tests themselves, but also the relatively low viral load that might be present in people who are without symptoms. The way to overcome the possibility of false negatives is to make sure that people are using the proper test, which our local hospital systems are, and also to do a repeat test. So for instance, somebody who's just been placed on quarantine might get a test done when they initially go on quarantine, but it actually makes sense to repeat that test 5 to 7 days into quarantine to increase the possibility that you're going to get a diagnostic test. Also, the way that the specimen is collected is quite important. And as many people are aware, the primary testing is with a nasopharyngeal swab, which requires a special technique to collect the sample. Maybe a little bit more controversial than the false negatives or the false positives that have been talked about in the community. So false positives, so that's when somebody gets a positive test in the absence of actual disease. It's quite uncommon when you really look at the literature. Most of the tests that we use, because they use something called PCR, have a specificity somewhere between 99 and 100%. What does happen is if you're testing people who are in a very low prevalence region, it will decrease the positive predictive value. So even with a test that's 99% specific, if you're testing a population where the disease doesn't exist, there is the possibility of getting a false positive. The way to decrease the false positive rate is to do a little bit more targeted testing in terms of a population that's more likely to have the disease. But again, I want to emphasize that although people talk about false positives, when I've reviewed the cases of reported false positives, there's usually a good explanation. And for instance, if you test somebody on a Monday and they have a positive test, and then you test them again on a Thursday and their test is negative, drawing the conclusion that that first test was a false positive is probably not correct. The third issue I want to bring up with testing, which is quite relevant, and I guess it's the Finance Committee, is that cost of these tests is a real concern. When we initially were doing the testing and sending them to reference labs, the cost was kind of in the range of like $55 to $60 per test. But for a variety of reasons, the labs that actually run the tests are now charging somewhere slightly over $100, some $110. So there's a real question of who's going to pay for the testing. If somebody's ill and presents to the emergency room, the insurance companies, if people have insurance, are paying. But if someone's being screened, like for employment or because they're a student, there's a real question of who would pay for that. I've mentioned before this concept of batched or pooled testing. So that's a way to significantly decrease the cost of testing when you test a large group of people. So fortunately, on June 16th, the FDA did approve batched or pooled testing. The challenge is just because they approved it doesn't mean that you can go start doing it. Any lab that's performing the batched or pooled testing has to do what's called a validation study that demonstrates that their particular lab is able to accurately run these batched specimens. If you look at it from a commercial lab's perspective, it pretty much is a huge cost for them to do the validation study, only to reduce their revenue by a factor of 10. So commercial labs don't seem to be lining up to do this methodology of testing. But I think what you're going to see is that academic research labs, particularly through the university medical systems, are going to try and do this validation and then offer it as a service. There's also a research lab in the Adirondacks that I believe is talking about this. We've also talked about oral or salivary samples. And again, there's more and more evidence that that may be an accurate option. And then the third thing is the wastewater surveillance testing. So again, that would be a way to do surveillance in a low prevalent situation with an entire village or a university or something like a nursing home. That's being utilized in a number of countries and in some parts of a number of countries like in the European Union. It's also being used in New Zealand. It's something that could be used locally, but there's more development that has to happen for it to come to fruition. Speaking of universities, one of the main things that I've been working on is having an ongoing discussion with our 4 universities on their reopening plans. So from the Board of Health and from the Department of Health, we provided consultation. The SUNY system also is providing consultation and mandates and guidelines for them. And then the governor came out with a list of mandates and also recommended best practices. What I will say is that the 4 colleges are working very hard to come up with the best, safest plan for them to reopen. I'm very pleased with their eagerness to cooperate with the Department of Health. And they're really, I think once they finalize their plans, we're going to see that they're sort of going above and beyond what's required to make sure that they have a safe reopening, both for their students, for their faculty, and for their community. As some of those details become public, I'll make sure to share that with people. But again, I want people to understand that they are really working hard. And again, they're going above and beyond what's mandated to make sure that their reopening process is the safest it can be. As far as the process of reopening, so as everyone knows, I think on June 26th, rather, the North Country entered phase 4. I'm still waiting for somebody to describe what phase 5 may or may not be, but maybe it's just phase 4 and then we're done. There are some key challenges though, and I think everyone's sort of aware of this. So in New York State and the North Country region, clearly have a steady decrease in cases, and Dana's going to detail that some. But many other states in the country are in the midst or in the throes of the pandemic. So even though the first wave seems to have moved past us and is kind of headed toward the south and the west or the Midwest of our country, it's very possible that we could see a second wave of COVID, both in New York State and in St. Lawrence County, particularly if individuals from those high-risk states choose to travel to our region. Because our region, fortunately, has a very low prevalence, and also because immunity to this illness is still really not truly established on any kind of long term, really nearly everyone in our county is vulnerable. There's discussion of something called herd immunity. However, if you look at the research on herd immunity, you have to have about 70% of people in a community either vaccinated or exposed to the natural version of a virus in order to get herd immunity. And herd immunity is, of course, dependent on actually developing immunity when you have the natural infection. So though some people are saying, oh, well, this is going to be fine, we're going to have herd immunity. We're nowhere near herd immunity in this county, not even in the state. And really, there's no country out there where herd immunity is likely to happen until there's a vaccine that's developed. On a brighter note, there's been some research and publication looking at a medication called dexamethasone, which is actually an older systemic steroid that can be used. Remdesivir, which is a newer, much more expensive medication. And there's promising studies primarily in ill patients, particularly patients who are on mechanical ventilators. But at least with dexamethasone, it showed something like a 1/3 decrease in mortality in those critically ill patients. So that's important, positive news. However, I would just continue to emphasize that public health measures are really the most important thing. So as far as the challenging part of this, so in light of the risk of New York State residents, the governor announced a quarantine order for travelers from high-risk states. Dana is going to talk about some of the details of that. And although this is a sensible measure from a public health perspective, it clearly presents a challenge to the North Country tourism industry, which we know is partly dependent on these visitors, some of whom come from these high-risk regions. So I see that as a real challenge. So just to summarize from my perspective, we are fortunate in that there's been no significant spike or evidence of a second wave, despite us proceeding through the different phases of reopening and despite the protests that did occur in some parts of our region. The North Country has entered phase 4, going through phases 1 through 3 successfully. I do think from a public health perspective, our biggest risk does come from travelers from high transmission regions and other parts of this country. And unfortunately, the really only way to prevent that second wave is to restrict unnecessary travel and to quarantine individuals from those regions that are currently high risk. The most effective way, and really the only way for us to detect a second wave, is through the expanded screening that we're doing through testing. One thing that does come up, people talk about doing screening with questionnaires. However, I would just point out that all those questionnaires and temperature checks, while they're helpful, they by definition can't detect an asymptomatic person since they're asking people if they have symptoms. And it's that asymptomatic transmission that is so insidious. And I think when we look at a lot of the cases, it's asymptomatic people for the most part who are unknowingly spreading the illness. A big challenge again with this expanded screening though is the cost. And so these innovative measures that have been approved, face obstacles to be implemented. And we really need these innovative things to be implemented as soon as possible. So while we're waiting for those innovative testing, for vaccines, for treatments become available, the 4 pillars of the community health response, I would argue, are still the most important. And that's universal mask use, social distancing, hand washing, and encouraging people to be sort of aware of their own health. And if they become ill, the first thing they should do is isolate, and then they should contact a healthcare provider to avoid spreading this illness. And then finally, I just want to mention that obviously this has been a long, hard road for everyone in the county. I will again just point out that our Department of Health for the county under Dana's leadership has really done a tremendous job. And the county administrator, the sheriff, Mr. Button, all the people involved in emergency response and services have been working, tirelessly to get us to where we are, and they really deserve our thanks and appreciation. So that's my update.
Okay, thank you. Dana, you would like to add some?
Yeah, so I was going to just talk about the current status of the cases in the county. So currently we have 217 cases. And as we look at the trends of what's been going on in the past few weeks, we've had 13 new cases and 1 death since the beginning of this month, or June. We have had just 23 cases since the 15th of May, which was the start of the phase 1, and still 1 death since that time. We currently have 2 active cases, meaning we're doing the surveillance of their isolation. And so we have about 40 people on the quarantine process. So just about like 42 people that we monitor on that daily basis. With the amount of cases that we've had since phase 1, I said there was like 23 cases. Of those, 18 have been asymptomatic. So as we talk about those who have no symptoms and those who might not be aware of who have the COVID virus, it's important to know that we've seen a shift in those who have symptoms and those who don't, most likely due to the testing that we have done. And up until this point, we have seen about 1,600 people through the isolation or the quarantine process, which means we've made contact on that daily basis via text or by a phone call. Like Dr. Williams said, we've tested just under 18,000 people. So that's about 16,000, I'm sorry, 16% of the population here in St. Lawrence County. We have seen about 1.2% of these people be positive, which is down from 2.2%. We're still higher than most of the surrounding cases. So far, we have not seen any of the childhood inflammatory syndrome due to COVID-19, but there's been 225 cases in the state. We have seen 36 people go through hospitalization since the start of the response, and that's about 17%, which is what we kind of thought would be just from the beginning. As you look at the surrounding counties or those in the North Country region, I'm just going to give the numbers of what they have and then the new cases they've seen since this month started. So Franklin County has 30 cases and has had 7 cases since June 1st. Lewis County has 26 cases and has had 9 new cases since June 1st. Jefferson County has 86 cases with 11 new cases since June 1st. Essex County has 42 cases with 5 new cases since June 1st. Clinton County has 101 cases with 4 new ones this month. And then lastly, it's Hamilton County, who has 6 cases with 1 new case this month. When you look at some of the other cases close to us, there are 20 new cases in Herkimer County that have happened just this week. There have been 21 cases new this week for Oswego County and 210 cases new this week for the Westchester County. And this is due to travel to one of the states in the advisory, then coming back going to just a large event. And so with the new travel advisory, we had a call with all of the state, the public health, the officials and the Department of Health. And we learned what the role of the local health department would be with this new advisory. There are 3 ways that we would find out about the travelers that come into the state or that are going to be just coming back home. One would be through flight through 6 of the main airports. So 6 of the largest airports will provide a form to the travelers, and they'll fill that out and they will register them just before they leave the airport. The second way is if the person calls the local health department and lets us know, then we would actually enter them into the new CompCare system that we have for case investigation and contact tracing. And the third arm would be through the complaint line we have through the New York State website. And so that complaint, as you know, would go to the county administrator, to the county attorney, and to the sheriff. So they would let us know on those complaints, and we would contact that person. These individuals do go into quarantine, and we would follow them. Now, we do have the virtual New York system of contact tracers. And so we have not had a chance to use this system because our case numbers have been so low, but we will put them in the system and pass them to the virtual team so that they can do the contacting. So those are the ways that we would find out, and we would try to do the quarantine, then to try to decrease the transmission that may occur due to the travel. That is the update that I have. I didn't know if there was any questions just about the advisory or the current status.
Any questions for Dr. McGuire or Dr. Williams? Mr. Burke?
What message, Dana or Dr. Williams, would you have for people who choose not to wear masks in the grocery store or in public situations? What message should public health be giving them?
Well, there's really two ways to prevent the transmission of the virus. And one, it's to limit the contact to those who might be already positive. And the other way is to decrease the spread from those contacts. And one of the main ways to increase the spread is by the droplets. And so by wearing a mask, that is one of the best ways that we have. And so if we all wear masks, and so that is really the education point. It's not really on trying to make people do something they don't want to, but it's trying to realize how we can decrease the spread. And that can happen from just talking, from coughing, from sneezing. And we know that if we can keep the droplets to ourselves, we can decrease the spread. So that is really what we're trying to do with the mask wearing campaign, trying to say why it's important and why we want to be kind of courteous to those around us. And also, like we've talked about, there are just so many cases of those people who are asymptomatic or pre-symptomatic that don't know that they're positive. And it's just a good way then to prevent the transmission, because you may be out and about and not realize that you should be home due to the positivity.
Mr. Forsythe, you had a question?
Yeah, if John's done. I didn't know if John was done or.
Oh, I'm sorry, John. Were you completed?
Well, I guess the only other question, the only other follow-up would be if, how are we doing on that? And that may be difficult for public health to measure, but, you know, I guess anecdotally, the vast majority of the people I see wear masks, but there are individuals who don't. And I guess I'm just wondering, since this is such an important measure to prevent the transmission, if we are in any way able to track that.
Okay, thank you, John. Mr. Burke. Mr. Forsythe.
Well, I've got a few. The first one, I guess, is for Dana. You gave the stats on all the surrounding counties. How about across the river? Is there any update? Prescott, Brockville, that area?
I don't have the numbers on that right now. I will look for them and I'll provide what I find.
Okay. Just out of curiosity, I haven't heard very much from across the way, and I just wondered, and I know they're not allowed or whatever over. This is for you and both and Dr. Williams. Late this afternoon, I got an email about the Bassmasters coming up, and I also got a couple calls late this afternoon about people concerned about Bassmasters coming up. Alabama was mentioned. A lot of the fishermen come from Alabama, also Florida, also several of the other states. Dr. Williams mentioned asymptomatic people don't even realize they have it. I checked on the Bassmasters website Saturday. Most of the events have been canceled. The 3 events that they have listed are all New York State, which under Governor Cuomo's guidelines would require a 2-week quarantine before seeking to go on this. What is your feeling about bringing people from high-risk areas at this time for tourism to promote the St. Lawrence River? If it does take place, what suggestions would you have for watching them, evaluating them, doing whatever? The tournament, I believe, is 3 weeks from now. Based on the 2-week get here early quarantine, that means next week they would have to start showing up. And what is your, Dr. Williams' feelings on this?
So We have had a few phone calls with Bassmasters, those who kind of lead it here in the county and with county officials. There have been no answers. We've talked about some of the safety issues, some of the gathering restrictions. We did hear that between 40 and 50% of the anglers are from the high-risk states that we're currently monitoring. I know that they were in conversations with Empire ESD, which is partly who makes those kind of thoughts on what can happen. And so I don't know, Ruth or someone from the county level, I don't know if there's been more of those talks that have happened and if there's been any more, because I don't know that at this time.
Ruth,
How
can
about
you-
Dr. Williams? Does Dr. Williams have any input on that?
Yeah, I mean, I think I would just echo what Dana said. I think it's because New York State has made these regulations that are sort of beyond what the county is in control of. I'm not sure that it's a decision that's going to be made locally. I'm an avid bass fisherman, so I say
Same
what I
here.
say with that in mind. I can't tell you as a physician or as a public health professional that bringing people from a high risk area to our county is going to decrease our risk of COVID.
Absolutely. Okay. Well, that's my concern. The people I talked to earlier share the same concern. And if the state can't make the decision or the Bassmasters people can't, I believe we as a county should. And I think it's a discussion. I don't want to bring you guys into it right now, but I just wanted your feelings on it. But I think that should be a discussion we have sooner than later. So thank you.
Thank you, Mr. Forsythe. Mrs. Haggard.
Thank you, Mr. Chairman. I'm really happy to hear about how closely you've worked with the universities because I know in Clarkson particularly, and I'm sure St. Lawrence and even the public schools, there are kids from 50 different states and probably 20 or 30 different countries. So obviously they're going to have some sort of contingency plans, and I'm delighted to hear that they are working closely with you and realize that it could be a disaster, but we need them back too because they spend money in the county. So it's kind of a problem that they're not here, but it could be a problem that they're here. So I just wanted to say how happy I was that they were working closely with you because I don't know. I've often wondered why St. Lawrence County's always had so many more cases than the contiguous counties. And I tend to think anecdotally that it has to do with the fact that we have so many people from different areas that come here, more so than some of the other. I don't know if you can add to that, either Dr. Williams or.
Well, sure. So, I mean, I do want to emphasize again, as you said, as I had said, that the universities are taking this incredibly seriously, and I'm very pleased that they're going above and beyond what's mandated by New York State, based on the guidance they're receiving from us at the county level, because they understand that New York State's a big state. I think as a county we have particular vulnerabilities that aren't shared across the state. And the colleges realize, the universities realize that, and they're working incredibly hard to come up with a comprehensive plan to be as safe as possible. I will say that the Board of Health and I think the Department of Health had a discussion earlier in the spring when this was happening about the role that the universities might play in sort of essentially bringing the disease to the community. And I can tell you that surprisingly, that really wasn't the pattern that we saw in terms of the epidemiology. Like when Dana and I went through the list of kind of where the disease came, that was not the primary thing. So we want to make sure that holds true for this fall. And we will continue to work with them and report back to the county on how things are going.
Okay, so to partially answer your question, Mrs. Haggard, I don't think you were a board member at the time, but Dr. Williams spelled out we were actually comparing Jefferson County to St. Lawrence County and how they're similar populations. So basically, there's a ranking, and St. Lawrence County ranks 4th in the state for age, disabilities, and other medical dilemmas, I would think. Is that correct, Dr. Williams? Where Jefferson is like 50th. They're a young, much younger county.
So out of 62 counties, we were number 4 in geographic vulnerability. And so that was looking at some of the 4 factors that Mr. Akers referred to. So advanced age, people who live in multi-generational houses, number of people with disabilities, those sorts of factors. And we're actually number 4 in the state, whereas Jefferson County is number 60 on that index. It's something that's put up by some researchers at Cornell. So it just sort of emphasizes how we're more vulnerable as a community, which is why I think we have to redouble our efforts as we talk about different factors.
Thank you. That's very interesting information. Thank you very much.
Mr. Burke.
Dr. Williams, is that vulnerability related to transmission or to the outcome of the disease itself?
So interestingly, there's a separate index for outcome. And so we are more likely to get the illness, but not more likely to get serious effects from the illness, if that makes sense. And I'm happy to share, there are 2 different graphs that illustrate those 2 different points. I can recirculate them because they're quite interesting to look at. And I think as people, any thinking person who looks at the map of the North Country region, looks at St. Lawrence County, and here I am singing the praises of Dana and her team, and yet we have these high numbers. Partly we have the high numbers because we were very aggressive about testing earlier on. So I think we had better case identification. But I think, we share a border with another country. We do have a lot of people who live in congregate housing. We have all those risk factors that have been identified. So.
Thank you.
Okay, anyone else? I have one question, and that is, are all asymptomatic people contagious? Does anyone know? Dr. Williams, or?
I think that's a tricky one. I think if they're asymptomatic and shedding virus, that can be detected by a PCR, the sense is that they are potentially contagious.
There is some question too. I was reading something, but I can't remember where, just a paragraph or 2.
It's tricky. There's also people are finding we call people asymptomatic or pre-symptomatic, because what ends up happening with a lot of people is in the first few days after they've developed the infection, they don't have symptoms. So they're asymptomatic, but they then become symptomatic. So we sometimes refer to them as pre-symptomatic. And, when people look at the other coronaviruses that have been problematic, like MERS and SARS-1, what they found is that people who had that illness in the very early parts of the illness were incredibly sick. So, when you have influenza, which hopefully nobody experiences this coming winter because they get vaccinated. But when you have influenza, it's usually not subtle. Most people can look at their watch and say at 3:30 p.m., boom, I felt terribly ill. That was similar with MERS and the other coronaviruses. But with this, with COVID-19, people have this sort of prolonged phase where they're essentially pre-symptomatic. So it's not till day 4 or 5 that people start developing fevers and things like that. And so that's one of the reasons that's probably spread through the world so quickly, is that you have all these well-meaning people who are walking around, in some cases without masks, spreading the illness. And they're not bad people. They just didn't realize that they were sick. And then on day 5, they have a fever, and then they look at their family who's now becoming ill. So that's one of the tricky things with this virus, is there's this sort of prodrome where people are contagious.
Anyone
Mr.
else?
Chairman.
Yes, I'm sorry, Mr. Lightfoot.
I have a question, if I may.
Yes, you may. Go ahead, please.
For either doctor, we'll say that. Is there a plan in place to test any of the participants in either the Bassmasters or any of the other tournaments that are going to be held here in the county this summer? And if not, why not?
Dana, do you want to take that?
Well, it's difficult to state at this time because we're still in discussions of whether it happens or not and what type of events, can happen here in the county. So we're not to the point of knowing whether they're going to be here. I think if they do come here, I think, anyone who wants to be tested should be tested. And, this is a high risk situation since it's a large group that is getting together. But as far as testing goes, Dr. Williams, I don't know if you have anything to add.
Yeah, I mean, not specifically about that tournament for the reasons you said, but certainly anybody has a high risk exposure, I would encourage them to be tested. And again, that's, I think, what we're seeing with the nearly 18,000 people who've been tested is people who have an exposure, people who are high risk are coming in to get tested. And I would encourage people to do that.
Can I follow up?
Certainly.
That's not a requirement though, doctor, is it? They would have to agree to it?
So there's only a few groups for whom testing is required. And again, I think that's not the case for the people who may travel from a high risk state that's been identified. I think the only requirement for them is to be quarantined. Correct, Dana?
And for those,
Go ahead.
I just wanted to add that for those people who, come here from one of the states in the advisory, if they get tested and their test result is negative, we still need to quarantine them as well, because you are only, your test result is only good on the day you had that test done. And like we've been talking about, there's just more than one day, 5-6 days that you could still become positive.
Okay. And if you can answer this, what have you been telling or explaining to Bassmasters and the other entities that are going to be holding the tournaments this summer, as far as what would happen or what could happen that would cause public health to cancel the event?
So the discussions we've had so far are trying to learn what their plan is and how it's been modified from the previous years, not knowing what New York State is even going to allow at the time that the tournament is going to go on is what we've been kind of describing and talking about all of the recommendations that we talk about on a weekly basis. So we are still in trying to understand what their plans are. And so we've had a few conversations. They have many ideas of what they would like to do. And we have said, if, we have to wait until we know whether it's going to be allowed and whether there should be spectators, whether it should just, be the anglers. We've been having these conversations, but our last conversation was, I believe, on Thursday. And so that was still trying to learn their plan. And so they don't have a full written plan yet.
Anything else?
I have one more, Mr. Chairman, if I may, just to follow up.
Certainly.
Is the state of New York providing sufficient guidance to public health here in St. Lawrence County and the rest of the counties to enable you to make informed decisions about whether or not the events that are planned should go on as planned? In other words, is guidance lacking from the state of New York?
From our department point of view, and I'm not sure how, the county from all the other aspects fall, but we can call our state reps at any time and have these discussions. So, which I do regularly. So I do feel that we're supported in the decisions that we need to make as a department.
Thank you.
Thank you, Mr. Lightfoot. Mr. Arquette.
Thank you, Mr. Chairman. It seems clear to me at this point that our board, certainly I would support our chairman urging the state or the EOC to make a decision on the Bassmaster. We're 3 weeks out. This is something, that we need, that answers need to be given to. And so I just think it may help if we as a board urge the state to make a decision on this. Thank you.
Okay, thank you, Mr. Arquette. Anyone else? Does anyone know if the other 2 tournaments in New York, are they previous to ours?
They are.
They
I
are?
believe they are, yes.
In what time period? So actually, these anglers could be in New York State, could be quarantined, and be here for that 14-day period. Would that be true? True statement? Mrs. Haggard, do you have information?
I
Physically.
don't have information, Mr. Chairman, but I did speak to Brooke Rouse this afternoon about a different matter. And she has a lot of information, and I think she's on our agenda to speak tonight. And she did mention the other two tournaments, is it Plattsburgh and okay, yeah. And so some of this I think can be resolved, some of these questions we have when she comes to speak to us tonight, because she did have a lot of information.
Okay, this discussion will have to come out of her time, though. You realize that, so the time. is up. Okay.
Wow, okay.
Brooke is so brief.
That's putting the hammer down.
Brooke is so
Yes.
brief. She's unmuted, so no. Okay. Any other questions for our doctors before we let them go? I guess not.
Thank you.
Thank you, Dr. Williams. Dana, we appreciate your work, Dr. Williams. And Dana, I think you're next up with the resolution. So that resolution is modifying the 2020 budget for Public Health Department to accept additional funding for the Early Intervention Program. Moved by Nicole Terminelli, seconded by Mr. Fay. Dana?
So this is for the additional funding for the EI program. They're going to give this funding within the next in a 5-year span.
Okay, any questions for Dr. McGuire on this matter? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, motion carried. Thank you, Dana. Next up is Highway with Mr. Don Chambers. The first is the staffing and project update. Mr. Chambers.
Yes, thank you, Mr. Akers. Yes, the first thing is the discussion of the organizational chart. What I'd like to do is start by illustrating the changes at the bottom. The net changes in our organization is very minuscule. We're still at 87 positions. The full-time equivalents are down slightly from the 2019 level, but most notable changes in this reorganization was the addition of the Deputy Superintendent of Highways, the elimination of a senior motor equipment mechanic, the elimination of a sign maintenance supervisor, and with as far as the additions were basically the change to creating 3 highway maintenance crew leaders and eliminating 3 heavy equipment operators, and eliminating 10 labor positions and creating 10 motor equipment operators. And finally, the elimination of 1 temporary position to help facilitate our operations. I can tell you that from my vantage point, the changes have been helpful, and I believe are significantly helping our productivity. So I appreciate the board's support and doing this reorganization. And again, thank you.
Any questions for Mr. Chambers concerning this chart? Mr. Denisha.
Thank you, Mr. Chairman. Not a question, but a comment. When I first saw the proposal that Mr. Chambers presented, I thought it was a very good idea. And you know, we've for 2019 and 2020, he's been able to maintain the same number of employees. But he's the way he's addressed this. He's looking at the succession planning, and I think that's one of the things that we've discussed before. That hopefully it's in the not, hopefully it's a long, long ways away, but sometime Don Chambers is not going to be here. And he is putting a plan into place for an organization that can adapt to that. And kudos to you, Mr. Chambers.
Thank you.
Thank you.
Thank you, Mr. Denisha. Anyone else? Okay, seeing no, we'll move on to the resolution. Resolution is modifying the 2020 budget for the Department of Highways.
Mr. Akers?
Yes,
Mr. Akers, may I interrupt?
Yeah.
I was also to give you an update on our projects.
okay,
May I do that first, please?
yep.
Thank you,
Sorry to cut you off. Go ahead.
That's quite all right. I think it's very important to point out that with the CHIPS funding, our state funding that comes in from the state of New York to fund highway projects, we are being cut approximately $1.06 million from what the 2019 budget was to the 2020 budget. So in doing so, that's going to facilitate, unfortunately, reducing a few road projects within the county, and also looking at reorganizing, and delaying a large culvert project and adding another, which is basically an emergency situation. What that did also is it's more labor, and some of them are more labor intensive than the one that I'm postponing. Therefore, still getting a lot of projects done, reorganizing it to make sure we can get it done with the staffing that we have and the funding that we have. So with the decrease of 1.06 million from the state, I'm proposing in the resolution later on is to move the 300,000 from the bridge large culvert area into the roadway, which will basically drop our amount of roads by the mileage that we propose to do from 27 miles down to 23 miles of road. So unfortunately, that's some news that I have to bring to you that, I know isn't very palatable, but I believe is necessary to address the fiscal reality of getting cut by 1.06 million. Getting into the projects, the actual projects that we have going on, large culverts. We have several that we're planning to do. County Road 53 in Helena, County Road 39 in Louisville, that has been actually completed at this point. Another County Road 39 culvert, which will be started here in the coming days. County Road 47 Knapp Station near the intersection with County Road 48. That's one that I've needed to add. The structure after our evaluation will not make it another season. So that one needed to be added to the list. County Road 49, in Norfolk. County Road 10 in Lisbon off State Highway 68. That is done at this point. And County Road 15 in the town of Canton off US 11. Going down toward the Corning plant, that's done as well. The project that I'm proposing to delay is on County Road 51 to be rescheduled for 2021. The structure does have the shoulders closed and will need to the shoulders will need to be closed, but the main line keeping the through traffic will be able to be maintained. As far as bridges, we have Telkville Bridge in the town of Edwards. That's scheduled for this year and should be starting here within the next week or so. Jones Road, a bridge, basically two structures together. that we have the snowmobile bridge that we installed over. That is in design at this point and planned for construction in 2021. The halfway house road bridge in the town of Waddington, that is proposed to start design late 2020 and hopefully to construct in 2021. If the board recalls, that was a structure that I was just had to post for 9 tons after New York State inspection. Skate Creek Bridge in the town of Fine, hopefully to start design either late 2020 or early 2021 for a possible out year construction. Lacombe Road Bridge in the town of Norfolk, hope to start design late this year with construction in 2021. And Dutton Road is a bridge that we also sent out, received the flag on. The structure is still open, did not change its posting, and may need to have further discussions with the board about whether that is going to be funded. As far as road projects, we have County Road 11 in DePoyster, south of Mayhew Road, County Road 15 between US Route 11 and Old Canton Road, County Road 14 in Canton, between State Highway 68 going toward Morley, County Road 10 in Lisbon, State Highway 68 to the Town Line Road, County Road 28 near the intersection of 27 toward Ogdensburg, County Road 49, O'Brien Road to County Road 38, County Road 55, Helena toward North Lawrence, County Road 27, Clara Pierpont. It's in the town, around the town barn area, if you're familiar with that. County Road 24 in Fowler, from the Tri-County marker, basically Lewis, Jefferson, St. Lawrence intersection, back in toward Fowler more. County Road 25, Russell, in the Pink Schoolhouse area toward Russell. The proposed projects to reschedule for 2021 due to the funding cuts, County Road 10 in Rossi, County Road 20 in Herman, and County Road 54 in Lawrence. Now, those are all basically locally funded CHIPS projects. Following our federal state aid projects, South Shore Bridge in the town of Fine, that structure is in construction at this point, and plan to have that totally complete in 2021. The structure should be open to traffic by the end of the year. County Road 17 in the town of Russell and DeKalb, we have 3 culverts that were in construction at this point. Our bridge preservation project is on County Road 3, 8, 17, and 46. That is currently in construction at this point and looking to finish that by the end of the year. Browns Bridge in the town of Pierpont is in final design, and we hope to award in late 2020 with the major portion of the construction in 2021. Depot Street Bridge in the town of Brazier, Helena, it's in the final designs phase and right-of-way acquisition, but construction funds are not in place at this time. And we have a new bridge preservation project with a bridge on County Road 27 in DeGrasse. And also another bridge in that package is Island Branch Road in Fowler, which is near the River Road intersection, and hope to bid in late 2020 with the construction in 2021. County Road 35, Town of Potsdam is in the design phase. without construction funds at this time, and that's at the location of the Potsdam Morley Road. Northumberland Road Bridge in the town of Morristown is the Ready project. Hope to bid late 2020 with the early 2021 removal and utility relocation. And then the three outpost facilities, which we had originally scheduled for construction in 2020, with a proposed reschedule in early 21 for construction in that season. Sorry to throw a lot at you, and you do have a map up on the page right now, indicating the different projects and a general location of the project and what they are and the construction.
Okay.
Sorry that's tried to keep it brief, Mr. Akers.
It's a good map and it's spread out all over the place. I like it. So the salt buildings would be in another year then, is what you're saying?
Yes, we originally anticipated utilizing in-house staff to do some of the site work, but with the issues that came up right when we were about ready to go to bed with the COVID-19 and the restrictions, it did not allow that to go out to bid or to utilize our own staff on it. So unfortunate, but a necessity.
Okay. Any questions for Mr. Chambers concerning his plans for the highway department for the next couple of years? Okay, seeing none, we'll move on with the resolutions. Thank you, Mr. Chambers. Our first resolution is modifying the 2020 budget for the Department of Highways to reflect adjustments in the 2020 to 2021 CHIPS state funding. Moved by Mr. Denisha, second by Mr. Forsyth and Ms. Curran. Discussion, Mr. Chambers?
Yes, well, as I said in the project update, one of the things that I was suggesting is moving funds from the bridge large culvert area to the highway paving materials so that we could at least maintain 23 miles of road reduction from 27 that I had planned. And the addition of the County Road 47 structure, large culvert, and the deletion of the County Road 51 project or rescheduling, I should say, until next year.
Okay, any other questions? Okay, seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Aye. Opposed, motion carried. Thank you.
Thank you very much.
Thank you, Don.
Next up is our county attorney, Stephen Button. And the first resolution is authorizing the chair to sign an agreement between the New York Environmental Protection and Spill Compensation Fund and the County of St. Lawrence, New York, regarding certain tax delinquent properties. Moved by Ms. Terminelli, second by Ms. Curran and Mr. Sheridan. Mr. Button.
Thank you, Mr. Akers. It's obviously that time of the year where we're focusing in on our remediation projects, and it's been a good start so far. The resolution you have before you would authorize agreements associated with three properties you're already familiar with, Longshore, Skomsky, and Carr. The plan for Longshore and Skomsky is that we are hopeful to be able to have the DEC out and working sometime before the actual completion of the foreclosure through access agreements that they may have, but Carr is likely to not start until August 12th. We have continued to move forward legally, though, with the foreclosure actions on all three. I will note this past week we had some good news. The Haley House has in fact been remediated itself. While this resolution does not speak to the Haley House, I did want you to know that they went in, took out a 1,000-gallon tank. It had 800 gallons of material, and they took out some contaminated soil there also, but we're good to go forward with the Haley House. Separately, we are going to start moving forward with respect to the old Homestead Dairies location in Potsdam, where the current subway is at. They will be hopefully moving forward with drilling holes and doing some of the pit samples shortly, but it's our hope that remediation will be completed there fairly soon. Finally, Stan Smith's, we're finally done with it. That will be moving forward in foreclosure, and that is a great thing. I did neglect to mention that earlier today, we seized 4 different properties under temporary incidents of ownership. One is Route 57 Auto in Oswegatchie. We also seized the Melvin Bice location in Russell, and we seized 2 other locations that we are hoping to be able to move forward on. One of them is the Betty Davis location. You may recall the Betty Davis location is in the town of Fowler. We are hopeful to be performing phase 2s on those. The final property is the Grant location, or Grant's gas location on Route 11 between Canton and Potsdam. So those are next up on the list for the team. But as I indicated, the resolution you have in front of you is dealing with the Carr, Skomsky, and Longshore properties, authorizing the agreement between the county and the oil spill fund.
Thank you, Mr. Button. Any questions for our county attorney concerning this resolution? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Our next resolution is conveying an easement to the New York Power Authority for the construction, installation, and future repair of roadways to access Smart Path Moses / Adirondack transmission lines in the town of Canton, owned by St. Lawrence County. Moved by Mr. Forsyth, seconded by Ganesha. Go ahead, Mr. Button. And Mr.
Thank you.
Arquette. Or Tony, did you want to second that, or can you? Mr. Arquette.
I wanted to abstain and recuse from
Okay.
the voting on the matter. Thank you.
Okay. So noted. Thank you. Okay, so we'll go. Steve, would you like an explanation, please?
Certainly. The New York Power Authority recently contacted the county as a part of their Smart Path reconstruction of transmission lines for power. They are seeking easements over certain areas so that they can access those lines. This resolution would authorize the county to grant a small easement over a currently marked trailway at our former landfill at Pirates in Canton. It's my understanding that they have also reached out recently to the town of Canton, and the town of Canton granted a partial access across part of their land. The access that we are talking about is across the existing drive area. So this would not be traveling into the heart of the property itself, but actually utilizing the existing roadway that would get them back to the trail location or back to the Smart Path transmission line. So once again, the resolution is merely to authorize the chair to be able to sign that document, allowing them access for ingress and egress to those transmission lines.
Okay, Ms. Terminelli has a question.
I'll need to abstain from the vote.
Okay. Okay. Steve, this doesn't involve the landfill, does it?
No, it does not. It actually rides on the perimeter of the landfill, but would not have disturb any of the land there.
Okay, thank you. Any further questions, Mr. Perkins?
Thank you. Is there any way that we can get NYPA to consider to allow easements for the multi-use trail system with this?
Mr. Perkins, anytime you're engaged in negotiations, it can't hurt to ask what concessions they may be willing to make if we are gracious in our grants as well. So if the board would like me to inquire of our trails advisor and talk to NYPA about the possibility of some form of exchange, I'd be more than happy to do that.
I'd like that, please.
Doesn't hurt to ask. Any further questions concerning the resolution? We do have 2 abstentions, Ms. Kelly, Mr. Arquette, Ms. Terminelli. So other than that, all those in favor of the resolution signify by saying aye.
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 Opposed? Motion carried. Okay, thank you. Our next resolution is establishing the Workforce Innovation and Opportunity Act budget for the program year 2020. Ms. Lajwa.
Good evening, everyone. I hope that you are well.
Okay. First, I have to have a motion moved by, I think, Ms. Curran, second by Ms. Turnbull. I'm sorry, Barb.
That's
Go ahead
fine.
now. Go ahead.
Okay, so what you have in front of you is the proposed WIOA budget for the program year 2020. Some items of note, there's a slight decrease in the cost of administration because we have 2 counselors that are expected to retire in this coming year. In all likelihood, we will only hire back 1 of them. So there's a slight decrease in cost, even with a new hire, if you remember from, I believe, the last meeting with someone to help in fiscal, because we're kind of understaffed in that area. We also received notice of a 16% decrease in funding in Title I adult, youth, and dislocated worker. So those are all reflected in the 2020 budget. The TANF number that you see in front of you, the $388,000 plus, is based on an estimate of last year's funding because we have not received final information on their appropriations. So overall, we have a slight increase over 2019, including the rollover from the 19 to the 20 program, which is why we can show a slight increase, even though we have a decrease in funding.
Okay. Thank you, Ms. Lashwa. Any questions? Mr. Perkins?
Yes, I'm sure I've heard this before, but I can't remember what it is. What is the TANF funds?
The TANF funds is temporary aid for needy families.
Thank you.
Okay, anyone else? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you.
Thank you. Take care, everyone.
You too, Barb. So next up is our Soil and Water Conservation District, Rianne Delansky, and we'll have a State of the Forest discussion. Rianne?
Good evening. Good evening, everyone. So the Soil and Water Conservation District Forester, Aaron Berger, has prepared the 2020 State of the Forest address that I'll share with you. If you have any questions that I'm unable to answer, Aaron will be happy to discuss them with you at a further date. There was one 2019 timber sale of standing red pine on 22 acres of county reforestation parcel 19 located in Colton. The logger requested a 1-year contract extension due to currently low timber market prices, so they have until 2021 to complete the harvest. 2020 sales, since there was an amendment to the annual timber harvest budget, reducing the amount to a sustainable level, there is no timber sale that'll take place in 2020. The county reforestation land will instead be managed on an acreage basis of 35 acres per year. This year's management is property boundary line maintenance. So far, this has taken place on 12 parcels covering 862 acres of reforestation land. Boundary lines have been marked with red paint and posted with county reforestation signs. Next, after the boundary line is complete on all parcels, we'll be working on updating the county forest management plans. These plans no longer accurately depict current stocking levels or species composition due to the extensive harvesting that has taken place in the past. Other activities that the forester has been working on is a focus with the invasive beetle emerald ash borer, or EAB. All species of ash trees are susceptible to EAB with a 99.8% mortality rate. Once the ash trees are infested, they become extremely hazardous very quickly, losing 80% of their structural integrity within 3 to 5 years. With this year's blonding survey, it was determined that EAB has moved another quarter mile further inland, spreading along the St. Lawrence River towards State Highway 37. There are a number of programs and projects that the district has been working on in an effort to mitigate their impact on St. Lawrence County. We've held educational workshops for EAB in 2 locations, one in Canton and one in Malone. Earlier this year, the workshop discussed whether to treat an ash or remove your ash tree, what to look for when hiring an arborist, managing your woodlots after EAB, and the danger and liability infested ash trees present. This was a joint effort with St. Lawrence and Franklin County Soil and Water Conservation Districts, National Grid, and a partnership between each county's EAB task force. We also held a tree planting and care workshop in partnership with the City of Ogdensburg in the fall of 2019. Participants were taught proper tree selection, planting techniques, and tree care. A total of 20 new trees were planted to replace ash trees that were removed in preparation of EAB. We have plans to do another program replacing more ash trees this fall. We also completed the 2019 an inventory and assessment of ash trees along the county roads right-of-ways, as well as any trees within striking distance of those right-of-ways. From this information, a database was created of ash trees that will become hazardous to public safety and a liability after the inevitable infestation of EAB. This inventory will help facilitate realistic management by prioritizing tree removal, identifying trees with potential to potentially treat, and budgeting for either treatment or removal. This project identified over 11,000 ash trees and an additional 3,000 hazard trees within striking distance of county roads. These trees will be scheduled for removal over the next several years in accordance to a multi-year action plan. This year, phase 2 of the project is currently underway, and it sees the inventory of ash and hazard trees along 1,800 miles of town roads in the county. We have another project for to slow the progression of ash mortality and reduce the rate at which EAB populations build and expand from known infestation areas. This is done by creating trap tree clusters around the infestation sites, allowing those clusters to become infected and then removing those trees, thus reducing the size of the EAB populations. Essentially, it's an attempt to hold EAB populations within that known area as long as possible and reducing it from spreading to non-infected areas. Currently, we have established approximately 200 trap trees throughout the county. And lastly, we are partnering with U.S. Forest Service and USDA Animal, Plant, and Health Inspection Service, APHIS, through the EAB Biological Control Program. This program involves the release of natural insect enemies, or parasitoids, of EAB to help reduce EAB populations in specific areas. There are currently 3 different species of parasitoids that have been approved for release in the U.S. since 2007. Release of the EAB parasitoids has begun in many infestation areas throughout the U.S. and are now establishing and spreading. These introduced parasitoids, along with woodpeckers, will help protect the regeneration ash saplings and young trees of the next generational forest. Soil and Water Conservation District has released parasitoids in 2 approved sites in the county. Approximately 600 adults were released, and we're assisting with the EAB Integrated Pest Management Study that is underway. This study will look at the survivorship between parasitoids and the EAB population over the next 10 years and the efficiency of biological control and the protection of regeneration of aftermath ash forests. So this highlights some of the activities that the district forester has been working on. Are there any questions?
Any questions Correct, Brianne? Okay, I guess not. Thank you, Brianne. We'll move on to the resolution is authorizing the chair to sign the 2021 local sponsor signature form as part of the grant application of the New York State Office of Parks, Recreation, and Historic Preservation. Moved by Ms. Curran, second by Mr. Burke. Any discussion concerning the resolution? Rhiannon, do you want to comment on this?
Just that this is the annual resolution that allows the county to be the local sponsor for the St. Lawrence County Snowmobile Association for the Snowmobile Trail Grant.
Okay, thank you much. Okay, end of discussion. All those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is modifying the 2020 budget for forestry for additional funding awarded to the Snowmobile Trail Grant. Moved by Mr. Perkins, second by Mr. Forsyth, Ms. Curran, Mr. Sheridan. Rhiannon?
The grant amount actually came in $22,816 higher than was budgeted. This was just a change in the funding levels at New York State. So the resolution is to reflect that additional funding coming in to the county.
Okay, any questions? All those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you, Rhiannon. Next up is planning. We have Jason Fotenhauer and they have a transportation update. I would imagine Mr. Doldo will be taking part. Jason, if you'd like to start.
Yes, thank you very much, Kevin. Good evening. You've been seeing quite a few transit resolutions come through the board in the last few months, and we thought that it would be a good idea just to bring in Frank and Matilda to give you sort of an overall perspective of what's happening with regard to ridership as we move through COVID, and also contracts. You've seen a number of contracts being discussed recently. So we have on the line Matilda Larson, who is in the planning office. She's our transportation manager. And also Frank Doldo, as you mentioned, who is our mobility manager. So I'm going to turn it over to Matilda and Frank, and then we'll talk further about the resolution after their presentation. Thank you.
Hello, everyone. It's good to see all of you. Prior to COVID, the St. Lawrence County Public Transit System had great ridership. As a matter of fact, the first quarter of this particular year had the highest ridership numbers in the history of the system. In the month of February, ridership was at 9,800 one-way trips. By March, as COVID arrived into the county, ridership declined by about a third to about 6,100 one-way trips. In April, the lowest numbers were at 1,500, so a reduction of about 85%. In May, that ridership number went up to about 1,600, and for the first half of June, we are projecting ridership to be at about 2,800 one-way trips. So in that time, as ridership declined, you may remember that the College Connector system, which we will be talking about in the subsequent resolution, was discontinued as a precautionary measure. That did impact ridership. And in the interim, as a measure to assist the community at large, as well as students who may have remained on campus, we redesigned the first mile, last mile program into a dial-a-ride service so that people could continue to access essential services. As we were experiencing and dealing with the COVID epidemic, we instituted some very good precautionary measures to help minimize the risk of its spread through the bus system, and that included daily disinfecting of the fleet, posting CDC signs encouraging passengers that they will be wearing masks and or face shields, reminding them to sit apart and to wash their hands. We also discontinued the collection of fares. We waived fares to minimize cash transactions. And we provided essential services. So traveling to large gatherings was no longer going to be allowed, and passengers were then screened: will you be traveling to an appointment, to a grocery store, to your employer, to a pharmacy? So we were screening individuals to help minimize the risk of transmission at our destinations. So dial-a-ride services were provided, and they averaged about 400 trips per month. So from about March to June, we've provided about 1,200 trips to individuals. Also, what was provided through Volunteer Transportation Center and through ARC was to assist with the delivery of food to elderly shut-ins who had no other means of getting food delivered to them. And there was also a partnership formed with the Messina School District on providing food delivery to families who had no way of traveling to school sites to collect meals for their children. So there were some innovative ways in trying to figure out how to provide essential transportation to individuals who needed it the most. That's essentially a very quick recap of how transit was affected. We are hoping to see a rise in numbers with phase 4 opening and with the schools in the area planning to reopen in the fall. And I'm happy to talk about that further when we get to the resolution.
Okay. Go ahead, Jason.
Thank you, Mr. Akers. I'm not sure if there are any specific questions, or Frank, I see that you're on the call here. If you wanted to add anything further to Matilda's discussion of ridership, or I don't want to belabor the point here, but just wanted to make sure Frank had an opportunity to speak as well.
No, nothing more to add. Matilda did a great job.
Frank, did you ever get a haircut? You know, the last 3 months that you've been complaining about everybody else's haircut, but did you ever get yours done?
I finally got it done the minute the phase opened. I was there at 8:01 a.m.
Was this the $8 version or the $10 version?
No, see, I don't have a lot of hair, so it was $5. It was awesome.
Okay, well, that's great. So let's move on to the resolution. And the resolution is authorizing the chair to sign 4 separate contracts with Clarkson University, SUNY Canton, SUNY Potsdam, and St. Lawrence University to provide public transportation. Moved by Mr. Forsyth, second by Ms. Terminelli and Ms. Curran. If you want, Jason, are you speaking to this?
I can speak briefly, and then I'll look to Matilda or Frank to add anything further. As Matilda mentioned earlier, these are really our popular routes, the college connector routes that, as again has been mentioned, were discontinued because of the COVID situation. With schools being back in session, we do want to re-engage. We are going to be the recipient, or the county is the contract recipient now. In the past, this has been run through the provider itself, but there are requirements now through DOT that the county actually has to be the contractee, if you will. So that's the reason for you seeing this resolution here for the contract to be signed with the 4 colleges.
Okay. Any questions? Matilda, would you like to add anything?
No, that was pretty succinct. Once approved, we would proceed on having those contracts executed. At the moment, the contracts that will be executed will be with 3 of the 4 universities. St. Lawrence University was originally interested in pursuing the idea, but as a result of the current financial situation, they've opted to pause their interest at the moment and may revisit that at a later date. But at the moment, 3 universities that originally signed on are still interested in participating.
Okay. Mr. Perkins.
Thank you, Mr. Chairman. Jason, where's the funding come from all this? And do the colleges participate at all in any of the funding?
Yes, Mr. Perkins, great question. Yes, they do participate. There is also federal funding that helps with this, as well as state funding.
I'm happy to add a little more specific to that. About 2/3 of the operating budget for the bus system comes from the State Transportation Operating Aid, also known as STOA. They pay the county based on mileage and the number of trips provided. There's also some federal funding that accounts for about 10% of the total operating budget for the bus system. The College Connector system covers about 18% of the operating expenses for the transit system. And then the final last 10% comes from our bus route revenue.
Thank you.
Good. Anyone else? I just want to express my condolences, Matilda and Jason and the staff and the planning department, with the loss of Denise. I'm sure that she was a wonderful woman and that she's greatly missed. So,
Thank you. We really miss her.
Thank you very much, Mr. Akers. We appreciate that. It is a big loss.
Okay, so to the resolution, all those in favor signify by saying aye.
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 Opposed, motion carried. Thank you, folks.
Thank you.
Next up, social services with Heather Wenzel. We have a resolution authorizing the chair to sign a contract with the Workforce Development Board for a sublease agreement for space in the One Stop Career Center. Moved by Mr. Burke, seconded by Mr. Perkins and Ms. Curran. Heather, you got the floor.
Thank you, Mr. Akers. This proposed resolution allows for a new 5-year sublease agreement with the Workforce Development Board for space utilized by the Department of Social Services Employment Unit. This agreement has been ongoing for several years, and approximately 62.6% of this expense is reimbursed.
Okay. Any questions for Ms. Wenzel? Ms. Haggard?
I am going to recuse myself from participating in the discussion and voting on this resolution.
Okay, thank you, Mrs. Haggard. Anyone else? Any more discussion? Okay, so seeing none, all those in favor of the resolution signify by saying aye.
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 Opposed? And Ms. Kelly, we have one abstention, Ms. Haggard. Okay, thank you, Heather.
Thank you.
Next up is our county administrator's report. Ruth, you want to start with the resolution or?
Sure.
Okay, so the resolution is authorizing the chair to sign a lease with the Workforce Development Board for space at the Human Services Center for the One Stop Career Center. Okay, moved by Mr. Perkins, second by Ms. Curran. Okay.
So
Ruth?
you may recall that last year we talked about the changes in the WIOA laws that would require the space to be addressed, the partners to make decisions, and we put a short-term lease in place that expired at the end of June this year. So what we're looking to do is to put a lease in place for 5 years, for the next 5 years, which also allows the agencies and the partners that participate to make their rent due and owing to the Workforce Development Board. So this lease would be for 5 years. Keep in mind that I believe it's 8 years, between 8 and 10 years, I'd have to go back and look, that the ownership of the Human Services Center remains with the county. So they currently occupy 6,990 square feet and would continue at that same amount. The resolution you just approved is of one of the occupants, being social services, inside this lease arrangement. They ended the old lease at $15.27 per square, and they will begin the new lease at $15.50 per square. So as some of you longtimers may recall, the arrangement put in place when the building was built for the Workforce Development Board to leave Main Street always kept them a little bit behind what the rates were that we were looking at to operate the building. So we're working towards, and there's a formula that drives through the lease the amount that they will pay. So they will go from an annual of $106,000 to an annual of $108,000. Any questions on that?
No, go ahead, Ruth.
That's all I have on that resolution if you wanted to take a vote.
Okay, all those in favor of the resolution signify by saying aye.
Aye. Aye.
Opposed, motion carried. Okay, so now we have a COVID-19 fiscal impact discussion. Ruth?
So there are a couple avenues that we've been looking at with regard to how COVID expenses will be paid for. Over the last few months, you've seen some resolutions associated with the CARES Act and funding for departments like the Office for the Aging, Transportation being the largest, and Public Health. Also, we received, if you remember, a donation. That provides for almost 1.1 million in modifications associated with the CARES Act. So far, we have spent out of those funds $113,000. Now, the bulk of that, I'll just remind you, was $934,000 to address the matters that Matilda spoke to with regards to fares being waived and transportation not charging during the early onset of COVID. So that is associated with what we know now and what you've modified the budget for with the CARES Act. Second to that is the FEMA money with the federal declaration of emergency as well as the state declaration which follow. To date, we've spent $139,000 in expenses associated with COVID. To break down in large numbers, Office for the Aging has spent $52,000 in food associated with the increase that you've been made aware of. Buildings and Grounds has spent approximately just under $20,000, 18 to be exact, on modifications, on hand sanitizer, on wipes and disinfecting materials. And IT has spent $40,000 associated with laptop acquisition for the work from home. So that totals, with a few other expenses in there that we will be adding attributable to the salary expenses we've incurred, that is said to be 100% reimbursable. So we will begin, NICEX hosting a webinar tomorrow. We will begin looking to make those reimbursement vouchers prepared and send those out for reimbursement. So it has not been inexpensive with regard to COVID. However, we've also just been made aware this last week, much of the conversation about the FMAP money that we're supposed to be receiving has been let go of by the state and released to the counties, which will result in a $1.172 million cost that will not be received directly, but will be a reduction in our weekly share. So we're looking at more closely what that impact will be for the remainder of the year. We had been expecting 1.165. So there's a number of factors involved there, and we'll bring you an update when we have a better understanding of how this all breaks down. We expect that it will at least be $616,000 in reductions in our first 13 payments. So that is a bit of good news that we weren't sure we would expect before the end of this quarter. I wanted to also, are there any questions on that at this time? Okay. I wanted to give you an update on Saturday. Chairman Lightfoot declared a state of emergency for the month of July. So that will be June 27th through July 26th. What we also did was declare a burn ban for 5 days. So that goes from June 27th through July 2nd. And if it's any precursor to declaring a burn ban to make it rain, I think we're successful already. So what we'd like to do though in these situations is take a look at, on a more practical scale, what the weather will be for the coming days. So by putting this in place, it has the potential to expire on July 2nd, which would not then impact the 4th of July weekend. However, there were over 82 outside fires in the 3 weeks preceding last that fire departments had to respond to. They were becoming overwhelmed. So going forward, certainly we've seen rain over the last few days in different areas, different amounts and different severity, but we're hopeful by July 2nd, we'll be able to allow an extension of that for another 5 days or allow it to expire. That will provide for us to take a look at this throughout the month of July and only make the burn ban when it's necessary. And Matt Denner was consulted, and he is certainly communicating with the fire departments on a very regular basis. So I apologize if there was any confusion. I think even the reporting that I read online and in the media was a bit confusing to folks. But we have extended that state of emergency for the month. And if we needed to, if there were changes in the numbers associated with COVID, that we needed to declare another state of emergency related to COVID, we would need to seek Department of Health approval. So that wouldn't be added as an executive order under this state of emergency. That would be a separate process entirely. Are there any questions?
Mr. Forsyth.
Yeah, just a quick question. I noticed on the corner of 68 and 37, the fireworks, the tents are out. Is there any concern that now we have a burn ban in force with fireworks? I know that was always a big issue with EMS before. Is there any concern, or has it even been brought up?
Not to my knowledge. I'm sure it's a very relevant conversation, particularly with this weekend coming. And it's not only that tent, they're for sale in many of the store locations. So I think that's certainly something we could put a press release out as the week carries on to determine if we're going to move forward or not with an extension.
Okay, thank you.
Okay. I wanted to share a little bit of interesting news that is a little bit unlike things we've talked about recently. We're contacted by the NOAA offices of marine sanctuaries. So last week, in conjunction with Oswego County and Cayuga and Jefferson, there is an approval process going on now for the URI process, my apologies, for approval to create a marine sanctuary in Lake Ontario. And this was brought to us because just over the line in Jefferson County into St. Lawrence, there are two shipwrecks. One is named the Keystorm and one is named the America. And there's an interest on their part to include St. Lawrence County in their efforts as an alternative boundary to the National Marine Sanctuary. So while that is a process that has been undertaken, I believe, since 2016 and will continue for a number of years ahead, I wanted to find out if there's an interest on the board to get more information, to have them come and speak to you about what it means. I certainly asked the question about continuing along the river, but both funding and staffing levels dictate how much they can include. So to begin with, their alternative boundary would only include that area where those two shipwrecks are located. So it was an encouraging conversation. Phil Church, who is a county administrator in Oswego County, facilitated the discussion with Ellen Brody, who's the Great Lakes Regional Coordinator for NOAA. And there's great interest in including the St. Lawrence. But one of the important pieces, I think, when the word sanctuary is used, is a concern that it will restrict access. And what NOAA seeks to do is to make sure that whenever they designate a sanctuary, that it is what the region wants. So they conduct a number of public comment opportunities, as well as seek the local board of legislators' input. They also have an advisory council that would include membership from the county. So if it's something that the board would like me to pursue more information on, or to have them come report out to you about what their efforts are, I would be happy to do that.
Mr. Reagan.
Could we ask the county planning staff to prepare us a analysis of the pros and cons of such a venture? I don't know a lot about this. I'm sure many others in the room don't. There may be advantages to us. There may be disadvantages. I just don't think we know. And I think in addition to whatever those folks tell us, I think having a independent analysis from our own people would, and I know Jason and his people have a lot on their plate, but I think it would benefit us in the long term as we weigh any kind of decision.
Anyone else? I agree with Mr. Reagan. There was an article in the Sunday's Watertown paper about the shipwreck. So I don't know if what their intention is. Would it discourage hiking? Would it discourage normal fishing practices? That would be helpful that the planning could investigate for us. I would think. I would agree with Mr. Reagan.
So if there's no objection, then I can speak to the planning office about taking a look at that and connecting them with our NOAA representative that's working on this project.
Yep.
Okay. I did just want to give you an update relative to COVID on the complaints. To date, on the New York On Pause, we've received 151 complaints, and most revolving around mask wearing, social distancing, and gathering sizes. I would also mention that over the weekend, there were a number of graduations that took place, and we did not, our efforts were apparent to make sure that the ceremonies were special, but that they also followed the guidelines. I attended one myself, and while it was very different, they adhered to the guidelines that public health has put out there. So I think it was very good representation of them trying to follow the rules. But I think going forward, they'll, I think, continue to be the graduation ceremonies over the next at least month, for some of the schools, and I anticipate that they'll continue in the same manner. Are there any questions about that? And then lastly, I wanted to ask for a dialogue. I shared some information with you to give me some guidance on the meeting plans for July. So this is the last meeting that we've agreed to meet remotely. I did share some information with you specific to mask wearing and wanted to find out if you'd like to resume in-person meetings or continue remotely. I believe that Steve could speak to the executive order that's been extended to provide under the open meetings law for that to happen. And I'm hopeful that after some dialogue, a consensus could be taken so that we can plan accordingly.
Yes, as Ruth indicated, on Friday, 202.45 was issued. That is actually the 47th executive order by Governor Cuomo since this originally began. Executive Order 202.45 extends most of the prior conditions that have previously been extended under 202.34 and 202.35, backing up really starting from 202.01 up through to a 0.28. Included in those is the Public Officers Law provision under Article 7 that permitted for the Board of Legislators to appear remotely in the fashion that you have been during this event. That is extended now through July 26th. So this board does have the option of remaining in the current setup through the month of July if it so chooses.
Anyone? Mr. Arquette.
I'd like to be on record fully supporting going another month via Zoom. Thank you.
Anyone else? Mr. Burke.
Likewise, I agree with Tony. I think that unless somebody has a compelling argument that we're not serving the public, I'd like to still have the Zoom meetings.
Okay. Anyone else? Ms. Haggard.
Ditto.
Okay. I think you have your answer, Ruth.
Okay, so we will plan and announce the meetings to be held via Zoom for the month of July.
Well, wait a minute. Kevin.
Okay, Mr. Lightfoot, go ahead.
You see my hand?
Yep, I do now. Sorry.
Okay, so we've heard from 3 people. Let's hear from everybody else in the form of a straw poll or something, okay?
We can do that. So.
Okay, well, how about if we do that?
Okay. So all those in favor of continuing Zoom for the month of July, please raise your hand. Okay, so we have Mr. Burke, Ms. Terminelli, Mr. Arquette, Ms. Haggart, and Mr. Fay. 1, 2, 3, 4. How many is that, Kelly? Did you get them?
5.
Just 5. So all those in favor of meeting in person in July, and actually I can't see Mrs. Fiacco, or Miss Fiacco. I can't see if she voted yes or no. So.
I'm either way. I'm new. Go with.
So all those in favor of meeting in person in July, please raise your hand. So 1, 2, 3, 4, 5. It's a tie. 6, right? 1, 2,
7.
7. Okay. Sorry, Joe. I can't see your hand that well. Okay. Okay. So at 7 to 5. So would we give those that don't want to meet the opportunity to meet over Zoom?
Sure.
I don't see why that, I mean, would there be an additional cost, Ruth?
There would be no additional cost to continue on Zoom.
So why don't we do that? So it's up to your own, we certainly don't want to force someone to come. You have a question, Mr. Denisha?
No, I just wanted to comment on that suggestion. I think if we're able to accommodate the folks that would feel more comfortable via Zoom, I think it sounds like a good compromise, and if we're able to do it, I think we should.
Yep. Mrs. Haggard, would you like to comment?
I'd like to just second what Mr. Denisha said. If it's not a problem, some of us may have health concerns, personal things that would inhibit us from being there right now and feel comfortable with that. So I appreciate him bringing that up, and I'd appreciate being able to attend by Zoom.
Yep, I think we can make it happen. Mr. Forsyth.
I agree wholeheartedly. And just as an option, I'd like to be there personally, just because last week I have the old style iPod and mine went dead. I had 84 before I start percent and mine went dead. So I missed like the whole last technological event. So, and the executive session. So I'd rather be there, but that's just me. But I understand people not wanting to be there.
Yep.
So
Mr. Burke, you have a
can work with both.
Thank you, Mr. Forsyth. Mr. Burke, do you have a comment?
Well, yeah, I'm wondering if we would extend the same courtesy to our department heads so that they could use Zoom as well.
Absolutely. I think we can do that. That's we can make that happen, can't we, Ruth? So that anybody that wishes to attend, we're still limited to a group of 25 or less, correct?
I believe that number is 50 now.
Okay, all right.
But yes, we can accommodate. And I'll put a message out to the department heads. We have our department head meeting on Wednesday.
Yeah, okay. I think that Mr. Perkins has a comment. Rick?
Yeah, I was just wondering if we attend, is there enough space so that we can social distance without having to wear a mask?
I was just about to say it's 6 feet, so.
I believe we can accommodate that as well.
Thank you.
Okay, Mr. Burke again.
Just a question. I was under the impression that the masks were in addition to the social distancing, but maybe I'm wrong. I don't know.
Mr. Burke, I can speak to that. Under the executive orders indicate that you are required to wear a mask where social distancing is impossible or impracticable. So if you cannot maintain a 6-foot separation between you and a member who is non-familial member, you must wear a mask. However, in situations in which you're seated, 6 feet separated, it is not required that you actually wear a mask. And I highlight restaurants right now. You're not required to wear a mask if you are seated at your table and separated by 6 feet from the next unit, if that unit is from a separate familial residence.
Thank you, Mr. Button. Mr. Lightfoot, you had a comment?
No, Mr. Button took care of it.
Okay. Okay, so, all right. What's up next, Ruth?
Just a couple other items. At this meeting annually, I provide to the board my recommendation for the reserves. And up to this point, you may recall that the way that we have funded our reserves is through the results of the prior year. So we would love to get to a place where we can fund those in the budget. However, in regaining our financial health, that has not been an option. So we wait to see how the performance is for the budget. We take a look at the unaudited report that Renee provided to you last month. And out of that come the recommendations. So in all honesty, the conversation took place a number of times related to the current state of fiscal affairs, of which many are unknown. However, since 2016, the board has made a very good practice of adding to these reserves on an annual basis. So I think that though this year's recommendation is reduced from the ones before it, I think it's still important to make those recommendations to you, and we may find ourselves in a place next year where those reserves become of critical importance to utilize. So if you recall, in the unreserved, unappropriated funds out of 2019, there was $5.962 million added to the fund balance. And traditionally, that is the location for where the reserves are then moved to the areas in which we have designated and the board has adopted. So the first of those, you'll remember, is a capital reserve. And that reserve at the moment is at $1.5 million with the investments over the last 3 years. I would recommend this year that another $500,000 be added to the capital reserve, understanding that we are going to extraordinarily limit the $700,000 that we set aside for capital reserve for 2020 because there are so many unknowns. However, it doesn't mean those projects still don't need to be addressed. Secondly, you'll recall we set up an employee accrued liability. That's the second of the comptroller reserves that the board has created. My recommendation for this year would be $150,000, which would bring that overall total to $1.15 million. And lastly, the newest reserve that the board's created, and that's the self-insured liability for both health insurance and for the liability and casualty fund, right now has $500,000 in it from the first year of contributions. I would propose $250,000 be set aside to be added to that reserve. So in total, the number that I would propose being added to the reserves this year is $900,000. Now, while we know that once the audit is complete, that number will be adjusted down. However, in my recommendations, we would still be adding $5,062,000 to the fund balance in the unreserved unappropriated. So that would bring your total then in reserves from $3 million to $3.9 million. And again, I qualify that by saying, come the spring of 2021, we may need to appropriate from those reserves depending on how things change. Questions?
I don't see any, Ruth.
Okay, so that is, unless there's an objection raised, I will make those recommendations formally to the treasurer that she will provide those to our auditors when they arrive. The second recommendation is from the board to me with regard to fund balance policy. And just as a reminder, this year there is $1,536,947 set aside for the fund balance policy. Going into 2021, this is different. The process is different than that which we undertake for the reserves. The fund balance policy calls for 15% of appropriations to be dedicated in the fund balance before the board makes a determination not to contribute anymore. As you'll recall, we have not yet met the 1% annually in our budgeting, but we have in performance far exceeded the amount added to fund balance since 2016. So what I would ask for this year, with so many unknowns again, is that the board provide me the opportunity to go through the budget process and bring the number for the fund balance policy back to you. But the same principle applies, and that is the board's made very good practice of contributing every single year to meet this policy. Even if it's not more than $1, it would still be a contribution made to the fund balance policy for 2021. Are there any questions?
Mrs. Haggard.
I'm just trying to learn here. So the policy, is that our board policy or is that a state policy? What determines the policy, the recommendation for the fund balance?
So the state is very reluctant to provide us with specific guidance relative to fund balance. And I can share with you the policy that the board adopted in 2016, which calls for 1% of appropriations to be added so that the fund balance can grow up to 15% of total appropriations. And traditionally, that's been approximately, that number or that goal is approximately 34 to 35 million. Now this year, that number's grown because of the extraordinary year that we're having in highway. I would call that an anomaly. And my expectation would be that those appropriations will come back down. This year, they're $253 million. Generally, we're much closer in the 240s or 230s even. So that being the threshold over the last 4 years that we use as a guide, we would be hoping to achieve that 1%, and we have, and we've far exceeded it every year. However, it's very difficult right now to know how much the budget will allow considering the reductions that we expect.
Thank you.
I believe the
Sure.
15% did come, actually, the recommendation is actually from the comptroller's office, is it not, Ruth?
Well, it is what many counties do. So we have asked for many, many years, and they are reluctant to, their guidance typically is whatever the county, the local board feels is appropriate.
Yeah, I don't remember what it was when it was on the school board, but because if you exceeded it, you got your hand slapped and you had to spend it or drop your property taxes. So,
Yeah, there's not the same requirement for counties,
yeah,
but I doubt we'll achieve that soon.
Yeah, I don't think it was 15%. Okay, what else you got, Ruth?
Unless there's questions for me, that's all I've got.
Okay, thank you very much. So let's move on to committee reports. Our first is Cornell Cooperative Extension, Mr. Denisha.
Thank you, Mr. Chairman. Happy to report that although we haven't had a meeting, in a month, we did have a USDA food box distribution last Friday from 1 until 3 o'clock over at the Cornell Cooperative Extension Farm. And it was made possible through, food was provided by USDA, but it was made possible by Cornell Cooperative Extension, Church and Community Program, and Garden Share. And I think it was 270, I think we had 270 boxes of frozen meat, milk, cheese, yogurt, produce to be distributed for each family. And, we had a lot of volunteers there. Things went smoothly. By the time we distributed everything, we figured out what we should do the next time around to make it even better. But, unfortunately, we didn't have enough food to give to everyone that had arrived. But, it was a big success, and hopefully we'll get a chance to do it again.
Thank you, Mr. Denisha. For the Fish and Wildlife Management Board, we have Ms. Curran.
Yes.
So Fish and Wildlife Management Board, do you have a report?
We have not scheduled another meeting, and even though there could probably be Zoom capabilities, I've not heard anything from them on whether or not they're going to do that.
Okay, thank you. Fisheries Advisory Board, Ms. Terminelli.
We also have not had a meeting.
Okay, thank you. Mr. Chairman, did you assign the Governor Fair Board to anyone? Mr. Lightfoot?
I did not.
Okay, thank you.
I did not.
All right. Highway and Solid Waste, Mr. Denisha.
Mr. Chairman, we have not met as a committee, due to the COVID restrictions, but Mr. Chambers gave a very good synopsis of what's going on. So if anyone has any questions, I would refer them back to his presentation.
Okay, thank you. The Industrial Development Agency, Mr. Reagan.
Mr. Chair, if it's okay with you, I'd like to let Mr. Forsythe give the RVRDA report, because each month he would like to highlight some of the great things that his board is doing. And so Dave, if it's okay with the chair, why don't you take it away?
Okay, we'll take RVRDA. Here we go. Dave?
Hallelujah.
And
that's what I'm talking about, Jim. That's what I'm talking about. All right. They met last Thursday via teleconference. The audit was presented. It came back clean. There was no issues with the audit. The RVRDA approved a loan for $75,000 to In-Law Brewing. They're located, I believe it's Chase Mills, for an expansion project they have going on. And they also authorized a draw on, it's basically a line of credit for Curran Renewable for the ACO sawmill to buy some more equipment. The CDIP action, those are the community development monies. There's 100,000 allocated. As of now, there's been no decision. The applications are they're in the review stages. And then there's quite a few good ones this year. So hopefully, usually the process is it goes to the IDA, they prioritize them, and then we as a board or committee discuss them. So, and allocate the money. One issue I did point out with Patrick for the CDIP monies, I talked to him last week about it, was since 2016, there's a few projects that were awarded funds that never did anything with them. And I just, there's a lot of projects that come up to this board each year, and there's only $100,000 allotment with a 20,000 max. So really it's 20,000 projects, which we try to expand a little bit, maybe 10,000 here or whatever. I was a little saddened to see that some of the projects haven't gone forward, because not only the project didn't get done, but it bumped someone else out of getting the funds. So I brought that up just as a concern, because, I think there should be a way to redistribute the funds, which there is some sort of process now, but I think we're going to track it a little bit closer. Making sure that they're basically shovel ready and there's some sort of upkeep as they go along. But besides that, everything's good.
Good.
So that's about it from there. Thank you, Jim. I appreciate that.
Thank you, Mr. Forsyth.
Mr. Chair,
Mr.
Chair, if I
go
can,
ahead.
give a report on the IDA, I'll leave out the things we both worked on. The IDA, when the COVID hit, they started a program to assist businesses in the county, many of which were running into problems and facing lack of sales and revenues because of the shutdown and all the other things that went on from March, until now. And they had offered a moratorium with their loan package. They currently have $8 million in loans out, and 20 of the 60 businesses that have loans out with them took advantage of the IDA's offer to let them not make payments for about 3 months. That represented over 500 jobs, and those companies are now getting back into payment mode, and the IDA has over the course of the COVID initiated contact with over 200 businesses in the county, proactively offering assistance and working with their partners to get assistance to companies that had questions or needed help, or in some cases needed more financial assistance. So that's my report on the IDA.
Thank you, Mr. Reagan. Next up is Recreation on Trails Advisory Board, Mr. Arquette.
Thank you, Kevin. We met a week ago Saturday for a ride / meeting that went very well. We rode out of South Colton, and I had the good fortune of meeting with Mr. Sheridan there, and I had Attorney Button with me on my machine. It was a good day. We had a good productive meeting, and then again this last Saturday I rode recreationally on the trail, and probably in all of my years of riding, which are many, I saw the most traffic this last Saturday that I've ever seen on the trail, which means money's being spent in the right places, revenue's being generated very responsibly, I might add as well. We went to the Cedar Lodge. and a couple other different facilities, and they were strongly practicing the utilization of masks and social distancing. The proprietors at the businesses and the riders were as well. So amidst a turmoil of unfortunate events with this pandemic, it remains a great opportunity for people to have a little bit of fun while they're spending money. It's really very good for the county and very good for our citizens and folks outside of the county that are coming here to ride. So things are good with that particular county point of business. Thanks.
Okay. Not everybody that travels with their own lawyer, you know, that's. So, St. Lawrence County Chamber of Commerce, Mrs. Haggard.
Thank you, Mr. Chairman. I reached out to Ms. Rouse today, as I mentioned earlier, and they have not had a meeting. I haven't missed anything yet. They are having a meeting on July 9th via Zoom, and I may be having something to bring back to the board at that time after that. Thank you.
You should be aware that we don't give out fines for not attending meetings. So I don't know if what your husband told you, but we don't.
Thank you.
Soil and water, Mr. Burke.
We did not have a meeting in June. Rayanne gave a thorough report on the county forest. As of our last meeting in May, they were still down to one person working the office, but their report indicated that all the programs that hadn't been delayed by the state were continuing, and they were still responsive to anybody who was calling the office. So I don't have anything else unless you do, Kevin.
No, you covered it well. Thank you, Mr. Burke. So let's move on to old and new business. Our first resolution is setting a date for a public hearing on proposed law A number blah blah for the year 2020, setting the salaries for county employees. Moved by Mr. Perkins, seconded by Ms. Curran. Discussion. Ruth, are you going to speak to this?
Yep, I can speak to it, Kevin. This resolution traditionally follows the CSEA resolution when it's adopted. That resolution was adopted on May 4th with an effective date for both CSEA employees and the management and unrepresented employees of June 1st. So starting this process will provide for a public hearing next week. It will then provide for an adoption of the local law in August, should the board approve.
Okay. Thank you. Anybody have any questions? Ms. Haggard, are you wondering if you should vote on this or not?
Yes, that's
Okay.
exactly. What, do you have mind reading skills, Mr. Akers?
I do. I do.
Okay. But that is something that I was wondering about.
So, Mr. Button, could you advise Mrs. Haggard as whether or not she should abstain from this resolution?
Mr. Akers, my understanding is the guidance that Ms. Haggard has received is that she should refrain from voting on anything that could directly or indirectly impact the Department of Social Services. And while I see the impact here as negligible could be, it still does impact the Department of Social Services by way of the salary of the commissioner of the Department of Social Services. Ironically, the salary isn't even listed there for that position. Be that as it may, it is still listed in the body of the resolution.
Yeah, that's as clear as mud. Now you understand how Tony has got PSP every right. So whatever, would you want to make a comment?
I was just going to say, even the appearance of a conflict, I would recuse. So I will recuse in this case.
Probably just have a good idea. So any more discussion about this resolution? Seeing none, all those in favor signify by saying aye.
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 Opposed, motion carried. Okay, thank you. So Ruth, you're going to lead the discussion on the real property tax payment options.
Yes, so there were, at the last combined meeting, Chair Denisha raised the interest of discussing this further. And we have the treasurer with us tonight who's had an opportunity to take a look at this. But I did want, just for the separation of what the options are relative to the executive orders that have come out as well as legislation, have the county attorney speak to the differences and how this applies to a finite period of time. Steve?
Thank you. As we've spoken earlier, there are two laws that have recently been passed by the state legislature, and there is an executive order that has been issued by the governor, now actually several executive orders. The executive orders have dealt with RPTL 925-A, which, if you'll recall, back in March, we had a discussion about the authority vested in the governor to extend the time period by which taxes, real property taxes, could be paid to a local government without the imposition of interest, penalties, and fees. That authority is found within real property tax law, section 925-A. If a locality asks the governor for permission to impose a 21-day stay, the governor, through the executive order, can permit that locality to grant that freedom or that relief to their various taxpayers. Now, our tax collection date has actually come and gone. It's April 1st. So if this board were to ask the governor for that permission, you're really talking about the permission to extend the date by which individuals could pay their taxes from April 1st to April 22nd. That would require the treasurer to make an assessment of who may have paid their taxes late past April 1st, but before April 22nd in order to gain the benefit of that 21-day relief. That is probably an actually small number of individuals that it would actually impact. If you take a look at 925-A, it states that if an individual exceeds that 21 days of relief that is provided, that all of the interest, penalties, and fees that they otherwise would have been spared from having to pay will go back on the tax bill. So once again, you're really talking about a very closed window of individuals that could have benefited from the executive order extension for relief under 925-A of the real property tax law. Now, as I indicated, there are two state laws also that have been passed, one that has been signed by the governor, one that has not. The one that has been signed by the governor fell under Senate Bill 8122. Senate Bill 8122 extended the period by which individuals could file for additional abatements or exemptions. That changed the period from, if I recall correctly, April 28th to June 15th. So that time period has already passed. However, anybody who would have otherwise been able to apply, that time period was extended until June 15th. That was under Senate Bill 8122. Now, there is a bill out there that is still awaiting the governor's signature, but it has been passed by the Assembly and it has been passed by the Senate. That's Senate Bill 8138-B. 8138-B actually provides that a local government, upon the passage of a local law, specifically in speaking of a county, may extend the time period by which taxes, interest, penalties, and fees may be paid to that local government. They may also, during that time period, extend it in such a way so that no interest, penalties, or fees would accrue. Now, if you look at the language of this specific bill, it states that you cannot extend it beyond 120 days from the date in which it would have to be paid. This applies to installment agreements as well. So, for example, if you had an installment payment that was due on, say, June 1st, it is theoretically possible for the board to pass a local law extending the time period for that payment past the June 1st date up to 120 days after June 1st. Interestingly, that bill also provides for this to occur indefinitely, subject to the will or discretion of the board. So this could exceed long past the date in which the declaration of emergency under Executive Order 202 is set to expire. That is currently September 7th. So these are sort of the three options that the state has come up with. Now, separately, Ruth was kind enough to actually identify a circumstance that occurred in Franklin County. And this was a circumstance that appears to have been worked out between the treasurer's office and the county board. If you'll recall, the county board has a certain degree of freedom already vested within it under County Law Section 215, County Law Section 215, County Law Section 450, with which to waive interest, penalties, and fees. Well, the County of Franklin came up with a novel idea whereby they incentivized the prompt payment of taxes by indicating to folks that they, under an agreement with the treasurer's office, were willing to concede the interest, penalties, and fees if taxes were brought current by a specific date. That also remains theoretically an option for this board if it so chose. It's an incentivization program in order to get people to pay their taxes and potentially forgive the interest, penalties, and fees in order to incentivize that prompt payment. I will note that 8138-B has not been signed by the governor as of yet. So the extension for the 120-day period is not currently available to this board. But I will note that you always retain your discretion under County Law Section 215 to potentially waive the interest, penalties, and fees associated with tax accumulation.
Thank you, Mr. Button. Renee, would you like to add, our county treasurer, would you like to add anything to this discussion?
Yes, I guess I'll try to give you a little bit of information. I'll start with the 21 day that Steve talked about, the 925A, section 925A. That is basically when he was talking about an April 1st to April 22nd window. So our tax collection, that would be for current taxes that he was speaking about. At that time period in April, the towns are still collecting the town and county tax payments. So if the board was interested in doing anything retroactive like that, the board would have to request the waiver from the governor's office. And I believe all of the individual town boards would have to. And after that was done, and if the waiver was granted, which it sounds like the governor would do, the towns would have to identify the payers who paid between April 1st and April 22nd and refund those interests and fees collected, which, by the way, the towns keep. So the county doesn't have any interest in the interest during that time frame. Any questions on that part of it?
No.
Okay.
Is that 8122 or is that 8135?
That is neither. That is Executive Order 202.34 and 202.35 as extended by Executive Order 202.45.
That is a 21-day stay.
Okay, thank you.
So the 8122 that was related to abatement, it happened. It required no board action. It was already passed. And there's no action to be taken on that. The 8138B was not signed yet, and I'm not certain what other information I could give you on that. I will tell you that the treasurers, the New York State Treasurers, County Treasurers and Finance Officers Association did come out and stand against supporting this. A letter was sent to Dave Lucas at NISAC to forward to our elected officials before they vote on these bills. Obviously, it didn't have a big impact, but the general consensus was that it would not benefit the counties in general. Villages already have 5 months to pay. This would extend their collection an additional 3 months, which makes that collection period from June to January of next year. We re-levy taxes that are unpaid, and that has to be done in late November or December, so the county tax bills can go out. So it could get very messy. There's a hold harmless provision, I believe, in this that says the county would not have to make the municipalities whole. So I don't know that it'd be very attractive to the schools or the villages or the towns in any regards anyway.
Okay.
But it's not passed yet, and I'm not certain what other information I could provide you to help you with any information if you're looking at that, but be happy to get it for you.
You don't have any numbers actually of people that are delinquent compared to this time last year?
Actually, I don't have them right in front of me, but I know that a report was ran. I think Vicky's on the call and she can back me up or correct me if I'm wrong. I think when we looked at the delinquencies, they were last year and this year.
Yeah, they weren't much different.
Okay. All right, thank you, Vicky. Any questions? Does Mr. Arquette?
Thanks, Kevin. Renee, it's been a while since I've heard this statistic, but what percentage of St. Lawrence County residents own property?
I don't know that answer.
Well, the last number that I heard was somewhere around 30%. So as I spoke at the last meeting, we've got 30% of our people contributing property tax that are creating services to a whole bunch of people that aren't. We heard a lot of legal analysis from Attorney Button, and I appreciate that. If indeed what I got out of that there may need to be a local law driven to allow some relief to our property owners. If that is the case, and I'll follow up with Attorney Button in the morning. If that's the case, then I'll be moving something like that forward. I believe and continue to believe that the pandemic is not the fault of our property owners. And again, people that have been supporting a lot of other people that don't own property for a long time. And if they need relief, I believe even at the cost of the county, that I believe that they should have that relief. So I will be pursuing that after conversations with Attorney Button in the morning. Thank you.
Anyone else? Mr. Denisha.
Thank you, Mr. Chairman. You know, when I initially brought this up at the, I believe it was the Operations Committee, it was you know, and I had been in contact with some of our state representatives back in April in regards to this. And you know what I was looking for, and the reason I brought it up the Operations Committee is it's not so much you know, I'm not looking at you know, giving people additional time to pay their taxes. It's not charging. What I'm looking at is not charging interest and not charging penalties. And you know, and I understand that we have some taxpayers that are habitually late. They game the system. They don't pay. They will not pay for 2 or 3 years and then come in and pay it. And meanwhile, the other taxpayers have been subsidizing them. You know, and but if there's a case where there's a hardship, in a documented hardship, and I really and truly believe that if we can give some relief to somebody that really needs it in the form of interest and penalties, that if we can do it, we should do it.
Mr. Denisha, to comment with respect to your statement, I would just note that this board always retains the ability to forgive interest, penalties, and fees. It has done so with respect to prior conveyances in order to encourage economic development. So I believe this board could take those cases on a case-by-case basis and address it if it did not wish to develop an overall policy.
Just follow up by Mr. Denisha.
Thank you, Mr. Chairman. Yes, if I may, Mr. Chairman, if I may address Attorney Button.
Certainly.
Thank you. Yeah, Steve, that was my intention all along. It was not to do something that was something brand new. It was to do something that the board has always had the power to do. And I was just my whole intent was to urge the board to take advantage of that and to help folks that genuinely needed a little bit of assistance. Yeah, you know, and it's amazing as I've gone around to my towns. You know, most of the tax the tax is complete, some towns are even higher than they normally are in other years. But, my whole thing is this, if we have the ability to give someone some relief that truly needs it, I think it's incumbent upon us to do that.
Anyone else? Mr. Perkins?
Yes. Is there a way to get the number of how many or the percentage of taxpayers that pay their tax in the lump sum and who pays it in the installments and how many are actually delinquent? Is there any way to get that percentage wise?
Vicky, I'm gonna ask.
I don't think we've ever been asked for that, but I'd have to look at the information that we have available. I mean, we have the delinquent tax figure, each year we have a figure that gets returned to us delinquent that we could, create a percentage with. But the other information, how many do installments and how many pay in full, we've never looked at that before, and I'd have to look at the available information.
If we could do that, if it wasn't too much problem, I didn't know if it was just like a report you could run or something like that.
No, it's not a report. Like I said, I'd have to look at the information available to see if I'd have to look at each town individually or I don't think I have across the board way to look at it because the towns collect separately. So I'd have to look at 32 different towns to come up with a number for each town because I don't have all that information combined.
Yeah. All right. Thank you.
Thank you, Becky. Anyone else?
I'd like to add something.
Certainly.
Just, and I guess it's maybe a little bit in response to both Larry and Tony's. Our 2019 returns, our dollar amounts compare and the number of parcels compare to the prior year. So I don't know that you can point a finger and say that any of the delinquents are really attributable to COVID. I just ask you to consider that. And also the fact that we do budget every year. We have over $2 million budgeted, which this would definitely affect. And we're already looking at some troubles with other revenues. And I also think that you're restricting it to this year, my 2019 delinquent parcels were a little over 1,700 out of over 65,000 parcels. So once again, I think you could open up the door to benefit a reserved number who I understand are also paying the taxes or maybe paying the taxes. It's just a little more information for you to consider when you're making your decisions.
Okay. Good point.
Thank you.
Anyone else? Mr. Lightfoot, did you have your hand up?
No, I did not.
Okay. All right. Well, I would think that with the number of delinquencies being equal or somewhat similar to last year, that we should be fine. And I think it would create a nightmare for the treasurer's office. And the fact that the State Treasurers Association didn't want this to happen speaks volumes. So I wouldn't be in favor of it. I think probably what you're going to see is those maybe large property owners that own multiple rental properties. They're the ones that are going to take it in the teeth because they haven't been able to collect their rents or portions of them, and some of that will be excused. So they're gonna take a chunk of their equity. I think they're going to take a hit, and there won't be any recourse for them. Okay, so that's it. I think we have a need for an executive session. Is that correct, Mrs. Doyle? Oh, wait, Mr. Burke?
We actually have Brooke and Bill here too, don't forget, or Bassmasters.
All right.
Sorry, Mr. Burke.
John, did you have a comment you'd like to make?
Yeah, it's in regard to the wearing of the mask, and I think I may have asked Steve the wrong question. The CDC guidelines and the World Health Organization guidelines do not distinguish wearing a mask alleviates you from social distancing. They both say both are required in public situations. And I'm wondering if Steve was quoting from a directive that maybe came down from Albany, but I would certainly think that we would want to follow the CDC guidelines and the guidelines of the World Health Organization.
Mr. Burke, if I may answer that question. I was in fact citing directly to a directive that came out as an executive order from the governor that mandated the mask wearing in those situations in which you could not abide by a 6-foot separation. I recognize that the CDC and the WHO have made recommendations regarding continuous mask wearing in public. However, I will note that right now that's not mandated. The only mandate is that you wear one if you are unable to maintain that 6-foot separation.
Granted, it's not mandated. I guess it's just the fact that, you know, we have totally supported our public health department. They've done a great job, and they follow the CDC guidelines. And I think we're remiss if we don't follow them as well. Anyways, thanks, Steve.
Okay, Mr. Arquette.
Yes, thank you. And I, you know, I don't like to point out one particular department because I thank all of our departments for the hard work they're doing through these trying times. But one department, the DMV in particular, has been under fire, I think, to a degree by some folks in the public and maybe even some folks in leadership. And I just want to send out sincere thanks to all of our staff in the DMV for all the hard work that you're doing through these trying times and under the conditions. And it may not be fast enough for some, but you're doing a great job, every one of you, and I thank you.
Make sure they get that message, Tony.
Thank you.
Mr. Perkins.
Yes. With the situation we're in, I guess I was wondering if we had some sort of list of properties, assets, type things that we have, and maybe a map showing these properties. I'm just wondering if we have anything that is excess that may be able to go on the tax roll for tax purposes. You know, if we could sell them or something like that. Do we have any type of list showing what we have?
Who are you asking the question of?
I guess
Renee?
I'm asking Ruth.
Ruth?
Well, there's a separation, I think, between the land and the assets. I think that the treasurer's office has done a tremendous job on the asset side of things. And I think we can pull the properties that we own through Real Property and get you some information on that. There is some land that we don't necessarily have open access to sell, but we can talk about that a little bit later. And certainly something we can provide to you, Rick.
Thank you.
Yep.
Okay. So just to Mr. Forsythe.
Yeah, just a question for Ruth. Ruth, in regard to the DMV, could we get an update of where they're at year to date with revenue sometime?
Yes. Yes, we can. I'll bring that to the board meeting. Yep,
I'd just be curious how it works in with sales tax. Thank you.
absolutely.
Okay, just to comment on the mask, because really, I mean, I think the CDC said don't wear masks in the initial, it's been all over the place. I read those documents that Dr. Williams put out. There's no empirical evidence. I know Tony responded and said, well, it's too early to tell, whatever. But you can understand, I'll just say from a public standpoint, when you have mayors that say, and like de Blasio, you go swimming, we're going to pull you out of the water, but yet allows demonstrations and protests or whatever. You have no social distancing, wearing masks. So I don't want to make this political. What I'm saying is here in St. Lawrence County, most of the stores and restaurants are going to require you to wear masks. But you can understand how the public say, wait a minute, how come I got to do this, but you can do that? So that's all I'll say. I'd like to move on because we're cutting into Brooke's time. So so we'll have a discussion about Bassmasters. Brooke, you're on.
Thank you. And I'll try to be brief. So we sent along something. We've been trying to get more guidelines from New York State, and I've been on the entire call, so I heard some of the conversation earlier, so I'll try to address those too. But the plan that we would like to pursue, the priority is really to help make the tournament itself carry on. That's the #1 priority. What we're looking at doing is partnering with restaurants to show the tournament live so that they can have their own watch events within the guidelines that are available to restaurants and get that money flowing directly back to restaurants all across the county. On Saturday and Sunday, we're looking at a model that's been used across the country to have a weigh-in that is in a drive-in format, such as a drive-in theater. So it would only be Saturday and Sunday. There would be absolutely no pedestrian traffic other than use of the restrooms. And that's at this point all we're looking to do. Again, there's no specific guidance right now on on professional sports. We were told at the end of last week that those should be available any day now. We were really hoping they would be available by the end of the day on Friday, and we were refreshing guidelines throughout the weekend as well so that we could update the safety plan. We have a draft, but we want to make sure it's specific to the guidelines. So we've been in frequent communication with Bass, as well as Senator Ritchie has been very helpful, and other New York State partners such as Steve Hunt and our partners at I Love New York, to try to get additional guidance really to have the tournament carry on. I included just a small bit of economic impact just from the tournament itself, not in anticipating that we will not have pedestrian traffic at Whitaker Park. And just from their staff and crew and anglers, it would equal 980 room nights for the county for their stay. I've been in touch with lodging partners throughout this, and again this week, to try to see if they are interested and willing to have long-term stay folks in recognition of the travel advisory. And they are all extremely desperate for visitors, and a couple of them are counting the days to possibly throwing in the towel for their business. So the tourism industry is prepared, feel comfortable and safe that they're following their guidelines to host people. Just a couple of the other questions from earlier, and let me know if I don't cover everything. But the New York State dates, there are 3 tournaments. One is in Cayuga, and that's the weekend before ours, starting July 14th. Then ours is the following weekend of the 23rd, and Plattsburgh the weekend after. So some of the anglers are already in New York State practicing. As those who are familiar with the event, you know, they have a window where they're allowed to practice in certain bodies of water and not. So some of them are already up. Others are waiting for the word on whether or not these tournaments are going to happen. The tournaments so far this year have, several of them have been rescheduled, but they are all set to happen in the same cities that were the original hosts. The last one that was held was 2 weeks ago in Alabama. So it will be a month between that one and this one, or that one and the first one in New York State. I think that is pretty much it. So we're again keeping in very close contact with the state to try to get guidelines, and are hoping that the county will support the host for this year. We'll be brief and open it up. Bill's also on the phone, so he can speak to some additional things.
Who has the first question? Mr. Forsythe.
Thank you, Brooke. What's the absolute drop dead date to cancel this tournament if it takes place? What's the latest date?
My understanding is that we're entering a 48-hour period with Bass. They need to make the call. They need to make the call because it's 3 tournaments in New York State that they will have to relocate.
And what's the feeling for the other 2 areas? Are they confident the show must go on or will go on, or how are they?
I think they're planning on the show to go on. They've also been in touch with Bass, and because we've been the most proactive in communicating with our state partners, they're all kind of waiting on us.
Okay. I have had concerns. I've got people that are involved with this group that have concerns, business owners that own restaurants that have concerns. Now you just told me, or I heard that 2 weeks ago, they were in Alabama, one of the hot spots, which a 2-week incubation period. We've just discussed masks in our public meetings and the concern about that, and we're going to bring all the Bassmasters to New York State from the hot spot. I just have a real issue with that. I have a sincere issue with this. But, and I know they need as much advance notice if it cancels. I pulled up the Bassmasters website. I saw all the cancellations that have happened from March till June. They all said, yeah, we'll see you next year. I've heard from the people involved with the Bass organization that even if it doesn't go through, they'll be here next year, no question about it. And my one thought was Bassmasters publication has about 3.4 million subscriptions. Buy a full page ad for a few $1,000 and say, we'll see you next year on the St. Lawrence River. For the safety of our citizens, let's cancel. So those are my thoughts. So
yeah, and I'm certainly, we've been working very closely with public health and appreciate the public. We're certainly coming from a public health perspective, and we've talked to Bass from the start about there would be requirements for testing and quarantining and all of that, and so that's what we're looking for more specifically from the state to say, what is that? Is it on day 4 that they need to be tested and need to be quarantined for that time? Do they need to head up now and find a place to park it for 2 weeks, which would be a good economic impact as well. And the lodging partners that I've talked to in the last week have offered to do room service and take out there and help support. They're very happy to do anything they can to help. So I completely understand the concern, and we've just tried to think of a way that would protect our community while providing the benefit.
Ms. Curran.
How many anglers are there, Brooke, that are coming?
There are 87 competitors, and Bass said about 40% of them live in the hotspot states. That doesn't mean they're there now. He said he could give us an update of that. Like I said, some of them have already been in New York State for a couple of weeks. Others have been fishing other parts of the country.
Okay. Mr.
Kevin,
Reagan.
sorry, Kevin, I had one more question.
Follow-up? Yes.
I do. So we're talking at most at like 40, 50 people that come from hotspots. I just want to kind of, I guess, give another way to look at it. Many of our emergency room doctors that come here to work come from hotspots. Many of our doctors that come in town to travel into come from New York City and other hotspots. Certainly truck drivers that come through do. It's something that we're cognizant of, that these people are from hotspots, but is it any different than all the other people that come here? And could we not sort of socially distance this if people aren't going to go, versus shutting something like this down? I guess just another way to think about it.
And Bass has a plan for operating their events so that they are socially distanced, and they're willing to abide by whatever guidelines we provide. They just need them. So.
Okay, thank you, Brooke. Mr. Reagan.
A couple things, Brooke. Do we have any idea how many of the competitors will be on Cayuga Lake for their competition, which is a week and a half before ours.
I believe it's almost the same. It's the same group of people. They travel in the circuit, and they're competing event to event to gain points and move forward in the competition. So they likely will all be here for the entire month of July.
So and usually they show up at the tournament site a week before the actual tournament. Is that usually the case?
Correct.
5 to 7 days.
Yeah, and there's a window. I don't have the specific window in front of me right now, but typically they come a couple weeks before because they're not allowed to fish just before the tournament. And so that's why, for example, some people are here now with plenty of time before the Cayuga event, and then they'll just be in the state for the.
So basically, most of that will be in New York State for more than 14 days before they arrive in St. Lawrence County.
Correct. Yeah.
So effectively, they will have gone through the period where if a problem is going to turn up, it will have turned up, prior to their arrival in St. Lawrence County.
Correct.
And is Dana still on the call?
I am.
Dana, no, she's
I'm
gone.
No.
She's
Oh,
here.
she's there.
Oh, she is.
The one without the beard. Dana, do we have the capability, or not we, but the hospitals in the county, do they have the capability of doing the batch testing?
To do the batch testing, is that what you said?
Yeah.
Not at this time. So it was just approved by the FDA, and so they still have a few hoops to go through before they can start.
Okay, I was just curious. Thank you.
Okay, thank you, Mr. Reagan. Mrs. Haggard, I believe that you had a comment, and then Mr. Berg.
Well, I'm glad Dana's still here, and I think Mr. Reagan just brought it up. The difference between having a doctor come to the ER and work is that he has access to testing. We're not testing these guys, right? These people are coming in without being tested. So, is there some requirement there, or can we get that information?
I think those are the guidelines that we're waiting for and told that would be coming. We were hoping by Friday for specific to professional athletes. Fishing is important to us, but there are other things around the state, such as the Saratoga racetracks and the US Open. I mean, there's some pretty major athletic events around New York State that are huge economic drivers. So our anticipation would be that those guidelines would include testing, much like hairdressers are included in the travel advisory. There's specific timelines based on how much time you're spending and when you're getting tested. Dana, I'm sure, knows more specifically, and I don't know if she knows more on this, but I think we're all waiting for those guidelines for professional athletes.
And do these guys, I'm not familiar with their personal whatever, but do they come with an entourage, or are they usually by themselves, family members? Would they have to be included in that?
Yeah, I think anybody who's traveling and within the travel advisory would need to submit to whatever the guidelines are. I would think. We just don't know. We don't have the guidelines. So
thank you.
Okay, next up is Mr. Burke and then Mr. Arquette.
I hope I didn't miss anything in the discussion, but the idea that the bass fishermen wouldn't go back home between tournaments, I guess is confusing to me. Jim's argument seemed to be framed around the idea that if they're in Cayuga and they stay in New York, they've already, the time for quarantine has already lapsed, but that's assuming they stay in New York and don't go back home or travel to any hotspots. Unless I missed something, I think it's I just don't know that that's a sound argument.
Can I make just a comment, John? So one, they are allowed, if I remember correctly, they are allowed to fish the week before the tournament, but not the week of the tournament. So if those individuals were in Cayuga and finished the tournament, and there's only 2 weeks in between, they would come up here and fish the waters of the St. Lawrence for a week. They could. And then they could not fish Monday, Tuesday, Wednesday, or the weekend, I believe. I don't remember the exact, but it's the week before, but not the week of. So, and most of these guys are running around in Toyota trucks, which is a major sponsor. So, and majority of them are single and they don't have their families. I remember the first year though, we sat with a family from Louisiana. They had his wife and the young son with them. So I think, fishermen aren't going to travel with their teenage kids that are going to be bored out of their skulls, but that may answer part of Jim's Reagan's. And I think that would probably be something that the governor or whoever, state public health, will weigh in on. I think.
And I think it's important to remember this is their profession. And so if they're told that they cannot compete for $100,000 unless they stay in New York, they're gonna stay in New York. We've already heard that some of them, as soon as they heard of the travel advisory, got in their cars and headed up to New York State, because again, this is their profession. If they need to be here, they need to be here. And so they'll make whatever commitment to that.
Mr. Arquette.
Thank you, Kevin. If I'm not mistaken, I thought our medical advisors told us in their report that that this decision would be made at a higher level. And then at the beginning of Brooke's report, I thought that she said that the state was waiting on us. And then later in her report, she said, we're waiting for guidelines. And then as Mr. Forsythe had said earlier, if somebody's got to make a decision, and if it's got to be made, then we will make it. Could somebody help me understand who is making the decision on the cancellation?
I can just clarify what I said. I apologize. We are waiting on New York State to provide guidelines on professional athletes and how to handle this specific event. There's been frequent communication, but we have not received those guidelines.
I appreciate that. Thank you, Brooke.
And if I'm not correct, I believe that the governor has moved. I got it, Joe. The governor has allowed the Mets team, New York Mets, to come north when the camps closed down in Florida, the spring camp for baseball training. I believe the team is here from the Mets. They're in New York. Okay. Rita, you had a question, but you've already talked once. Mr. Lightfoot.
Brooke, if I may address Brooke, Mr. Chairman?
Certainly.
Who are you dealing with in the state? You're dealing with ESD, or you're dealing with somebody from the second floor?
I have personally been dealing with Empire State Development through the tourism department, as well as Steve Hunt, which is our regional contact for ESD. And I know that Bill has been working very closely with Senator Ritchie, and I believe she has been contacting people higher up from that, but I don't know specifically who. And Bill is on, he's called in, and I think he has to be unmuted, so I don't know who's controlling that, but.
We're working on that right now.
Okay, that's
okay.
Joe, you have follow-up, Joe?
If you let me.
Certainly.
Okay. What is Hunt telling you with respect to where this is in the chain down between his organization, ESD, and the people down in Albany. Where is that? The question has been posed to them, I would assume, that we need guidance of whether or not this is going to be allowed or not. And I got a couple of calls today about that very thing. Is this going to happen or is it not going to happen? You can't wait until the last minute because of all the contractual agreements that have to be made, all the facilities that have to be secured, and everything else that goes along with this. Where did ESD leave you with that as far as when they might expect to have some kind of word, whether or not this is a go or if it's going to be canceled?
The last word we had, the last I heard from Steve was at noon today, and he said that the state is working directly with Bassmaster on this and discussions are continuing. I heard from our contact at Bass, they received a call from the tourism department, and the tourism department asked, or the director of tourism asked, when do you need to know? And Bass's response to them was now. And
Okay.
he said, understood, I will get back to you as soon as possible. That, I believe that call happened this morning.
I think we have Bill Dash now, do we? Bill, are you there?
Call from the tourism department.
Yeah. Okay. Bill, if you'd like to make some comments, go ahead.
Just a little bit of a clarification.
Okay, we're not hearing you. You're out by the big tree or something. Step around the tree or we can't hear you. Try again, Bill. No, we can't hear him. We can't hear him, Dylan.
Okay,
Oh,
let me try a different place.
that's good right there.
Yeah,
Right here?
Yep, right
Yeah.
there.
yeah, that's strong.
Okay, just a little clarification on the days they can fish. The pros can't fish 30 days prior to the tournament, it's off limits
Oh,
at each one of the areas. They can fish the first 3 days of the tournament week. And that's the way it stands. So the pros that have been fishing here, like Cayuga, they went to Cayuga first. They were there quite a while ago, obviously, when that 30-day window closed. They moved on to the St. Lawrence. They were up here until the first part of this month, and then they're on to, they're in Plattsburgh. Last week, they were in Plattsburgh. So whether or not they go home after the in-between tournaments, these tournaments are so close together, they're not likely to go home. And I can't say that for a fact, but it's not likely. There are a couple coming from Canada. They've been classified already as essential, so they're able to cross the border because of their livelihood. And I'm not sure if there was another question there. I'm being told by the senator who is in contact with second floor folks in Albany that this will be resolved very quickly.
okay, that's good news. Any questions for Mr. Dajna? Rita, did you have an earlier question? Your second question? No?
I'm gonna wait to executive session.
Okay. Any other questions for Brooke or for Bill? Okay. So we do know that you're looking for funding, an exorbitant amount of 50 grand, right? Versus the 30 that you got. So I don't know how the board can move ahead with any discussion about a financial contribution until we know that this thing is happening. So does anybody disagree with that or have a different opinion or want to state anything at this time to let Bill and Brooke know? Okay, Ms. Terminelli.
I just have a question. Would there be a possibility to amend the amount that's being asked for, seeing that some of the line items on that budget were to accommodate some of the extras for the spectators that were coming in?
Bill, would you like to answer that?
Excuse me, I can. What's happened because of the circumstance that we're in right now, Bass has reduced the cost to us. We have a contract. I'm not sure everybody knows that. We have a contract, a 4-year contract, 3 years for Elite Series tournaments. We're in the 2nd year of those 3 years, and the 4th year is a Northern Open. It's a lesser tournament, actually with more pros. But they have reduced, through this, they've reduced a number of things in there that have to do with people gathering, seminars that they would have to have, a dinner that we would normally have to provide for the pros, and runs usually around $4,100. And there's a number of things in there. I don't have the list right in front of me, but so in this contract, we're in that 2nd year, which is $50,000. And the way it stands, it's $60,000 for the 1st year, which was last year, $50,000 this year, $40,000 next year, and $10,000 at the 4th year, which is the Open.
Would any of the legislators like to make a comment? I don't see any hands right now, Bill, so I think, okay, Mr. Arquette.
Could we not proceed to be, Mr. Chairman, if indeed there was an announcement within the next 48 hours, could we not have a special board meeting to take up the issue of funding?
Ask Ruth about that. I think we can have a special board meeting anytime, but I'll ask her about the particulars. Ruth?
We would just need enough time. Typically, it's 2 or 3 days to make the meeting notice, but it also can be as practicable. We do, as a reminder, have a meeting on Monday, so I'm not entirely sure how far the funds that are currently available could go. If the board's supportive, that would be almost immediately replaced.
So I'll ask Bill. Bill, when's the check got to be in the mail to these folks? Or have you already sent that and you just need the contribution to balance the budget?
No, we have to pay them the week of the tournament.
Okay.
But there's an awful lot of preparation. That's what we're really concerned about between now and now in the tournament. Actually, it's closing in on us really fast, and we're really pushing hard to get these recommendations from the governor's office.
So Bill, we gave you 30,000, not you personally, Bass. We gave for the tournament 30,000. Why should we give you 50 this time? I mean, what's the need? Because of the lack of ability to fundraise because of the COVID, or what do you got?
The COVID is pretty much stopped all fundraising and really put a hamper on donations. As a matter of fact, it's stopped everything. Okay.
So that's all I have. Certainly, we could arrange. It could be at the regular Monday meeting. You think you're going to have an answer, Brooke or Bill, in the next 48 hours?
We certainly hope so.
Okay. Now you did mention, Brooke, that Bassmasters was waiting, or the 3 tournaments were waiting on us. Did I take that right? I mean, but I thought, why would they be waiting on us if the first tournament is down there?
I think we've been most active really over the last couple of weeks in being in pushing the state. We've been pushing the state for guidelines for several weeks. And so I think that Bass has told the other communities that we're knocking on the governor's door and that we should get the answers soon. I guess Bass is telling them that they're working with us to get the answers.
Okay, I'm surprised that Cayuga County isn't working just as hard or harder since it's closer to them. I mean, so much quicker, but whatever. Well, we'll wait to hear from you, I guess, right? Okay. Does anyone else have any questions before? I believe Ruth is next is executive session.
It is. I do have a brief update to answer Legislator Forsyth's question about the DMV, if I could, just before we move into executive.
Okay, let me ask Bill and Brooke if they have anything to add here before we depart.
Nothing to me at this point.
Okay, thank you, Bill. Brooke?
No, thank you very much for your time. We'll
Thank
be
you.
in touch.
Mr. Fay has a question. No? Oh, you're just waving? You're saying goodbye. Okay. All right. Okay, thank you. All right. So Ruth, would you like to fill us in with what the point you wanted to make?
So to answer Legislator Forsyth's inquiry about the current status of the revenue associated with the overall county clerk's department, the revenue is at 28%, largely driven by the downstate revenue, which is at 26%. Just as a measure point, in 2019, the overall department was at 38% and the downstate was at 37%. And in 18, we were at 40% revenue and the downstate was at 37.8. So roughly about a 10% difference at this point compared to where we typically are this time of year.
Okay, thank you, Ruth.
Sure.
Okay. So I need a resolution to move into executive session. Ruth, do we need all 4 categories?
We do not need appointments.
Okay, just negotiations, litigation, and personnel. Who would like to make that? Ms. Curran, second by Mr. Forsyth. Any discussion? All those in favor signify by saying aye.
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 Opposed? Okay, we're in executive session. We have to take a few minutes, Ruth.